Should she live? Okay, all right. I got the camera with me. All right, good. Cool. All right, let me go. No, no, no. I see. No live now. Yeah. All right. Yeah, yeah. Cool. All right, bye.
Hi, Daniela. I'm sorry.
Chrissy, Chrissy, where project? Project.
Wait, behind the
Are you there?
what is that?
Projector.
Oh yes. Shania's coming with the thing. You have to wait. She said she'll be here for us.
Stream is on.
You want to see me right now?
Yes.
Hi.
Microphone. The phone on.
Well, this will be for them. Oh, can you mute it meanwhile?
It should be set. You see now? Correct? No, check now, check now. See now. Yeah. Right like that. Right like that. Streaming on. Oh, actually, I just have to mute it.
Chicos. Ok. Sí, pero es que como vamos a estar así, no es mejor que... Bueno, si nos lo ponemos y lo pasamos. No, porque ahora en la presentación dejémoslo así, porque nos vamos a presentar.
Voy a empezar a shake.
No, yo shaking de que... Así la hazaña. Mira, Mike. Me dice, ¿estás en el chat? Yo, no, pero pensé que el chat de aquí, eso, digamos, no. Y yo,
Laquis.
yo, ay, este es el genio de la...
Sure.
Ok, ¿me escucho? Según yo, mira. Hello. No sé. No sé, creo que me dijo que le dijera. Yeah? Could you hear me? Yeah? Ah, okay. It's for okay. I understand. Hola. No se escucha acá. We are thinking that here is for this, for the room. No, it's for that.
It's for that. We were like, hello.
Hello. I'm just like,
I have it on mute right now. Oh, no, it's not. We just want to thank everyone for taking the time to come here today. We know you all have very busy schedules, and we really appreciate it. We have a great team from LOH who's here today, who are going to guide us on these great adaptive equipment. Any questions you have, they are here. I don't know if I'll be much help, but they are going to be the main help today. So I'm Christy Elias. I'm the head of the retail division for AA Laquis. I'm here for any guidance or anything you need. There's a bathroom right there, straight down to the left. It's a unisex bathroom. We have drinks, we have a tea station, we have tea around a break around 10 o'clock, and then we have lunch provided for you. So enjoy, and the team from LOH are gonna go ahead. Oh yes, also we have people logging in from Barbados and Jamaica. We have around 37, 47 people logging in, OTs and PTs. Woo. Wow. So our team in, oh, they said they're hearing us clearly. Perfect. Just message your questions on the chat, and whatever questions you have, we will respond to you. They said morning, everybody. Morning. Okay, go ahead.
Thank you and good morning, everyone. Thanks for being here. My name is Giselle Espinosa. I am physical therapist. I have been working in law medical for 30 years. So I hope, have the experience that I will do the best because my native language is Spanish, as you know, as you can see. So I will try to explain you everything in my English, but sometimes maybe Gismark is more bilingual than me. So in some cases, if you don't understand something that I am talking about, please raise your hand and ask me everything that you want. Okay. So here is Daniela.
Hi, good morning. Same, English is not my first language, so if you have help, please let me know. I am the sales representative from the medical with Bismarck. We are in charge of the Caribbean and health. So thank you for being here.
And Gismark.
Yeah, my name is Gismark. I am from Nicaragua, but I'm currently living in Mexico. I am currently serving as a sales rep for Trinidad, and I'm a biomedical engineer by profession. I'm very excited to be here in Trinidad for the first time, and I thank you all of you for coming and having some time in your agenda. As Christy said, I guess most of you are very busy, so we're very happy that you were able to come, and we hope that this session will be a very useful information for all of you. So once again, thank you all for coming.
Okay. So we going to start with the topics, with the agenda. So the agenda is, first of all, the importance of our role as OT, the steps for the correct wheelchair's prescription, clinical, anatomical, and biomechanical foundations or bases, frame types, materials, and tilting space, adult and pediatric equipment options, patient assessment and measurement theory. I think is the most important, right? But everything in a mix, it's the key of that assessment. Hands-on workshop, so we will have two patients, right, with us, so we can practice that theory in a life, and then you will be the presenters. So you will going to present one case or the cases that we will look. So that is the agenda for this day. So the TO's role, as you know, you are the professionals. So the wheelchair is not the destination, is the means. So the wheelchair is not just a chair with wheels, it's more than that. So in your role, it is important to know that the people needs more than a chair with wheels. They need more specifications. They need more special parts in the product. So for example, if I give you, I don't know, a shoe, I give you a shoe, and maybe you are waiting for the shoe many years, and then the shoe is very small for you, But I said it is, so I can give you that. It is dishes. So you have to work, and you have to walk a lot, and then you have to use that shoes. And maybe you will have scars and everything, right? Deformations, deformities on the foot. So, and you have to say thank you, right? Because I gave you. So it's the same thing with our patients. We said, okay, you have this chair with wheels, and you have to say thank you. I don't know if you need it. I don't know if it is fit for you, but I gave you, I am giving you, so say thank you. Why? It's not correct. It's not correct, right? So you are the voice and you are the face of their patients that need you. You have, we expect you have the knowledge, you have the expertise to know what product is the best for that patient, and they trust you. So it is very important the role that you have. So in this day, we will do the best to let you know that keys or that skills that you can develop in your career and your daily work to help that patients. So those patients, sorry. Oh. Actually, I move a lot. I am like electric woman. Okay. The impact of that poor prescription, it is very important. Your responsibility is big with the patients because you are signing that prescription, that assessment. If you put something wrong, you affect the life of the patient. So it is very important. Your role is very important on this. And then active listening. The patient is our priority. His or her needs, the requirements. You have the knowledge about maybe the diagnostics or pathologies. Do you have the knowledge? Maybe you know what could happen with that patient with that diagnostic, but the patient doesn't know. So the idea is to listen their needs, their desires, and then put in a prescription and then put in a product, in a final product. Okay, so now our base, the World Health Organization Gates said, we are based on the patient needs, and then the environment, then the social security, and then the family. So, but in a group, as a group, it's an integrated evaluation, but based on the people, on the patient. So I have here a video that I want to share with you because I think it is made as to make us more conscious about our role, about or how we change the lives of the patients and how important it's our role. So I am PT, but I understand the OT career. So it is very important that you know why you are very important to them. Okay, so I don't know if I audio here.
That's right.
No, no. I
I have
could you? It's in translation in Spanish.
these types of programs back into their local communities and strengthen and grow and sustain services for wheelchair users well into the future. I have an easy job, and that's providing the resources to you for the work that you're doing on the ground. And so it's actually an honor on my part to be there, to see the programs, and to be able to provide support.
Okay, so nice, right? So, who defines 8 steps to do a good assessment? But then, years later, he said, okay, reducing 4 steps. So now we will see 4 steps, but it is 8. 8 is more specific, but we can close in 4 steps and would be great. As you see on the video, maybe you don't have the ultimate or the last innovation or the biggest technology. But if you have the knowledge and you have the conscience about your patient needs, you will have the ability to adjust any product to their necessities or their needs. Okay, so you see, maybe you don't have the last quickie wheelchair with the whole innovation and the whole technology, but you have a wheelchair that you can adjust to that patient to be functional. So here in this training, we will try to let you know that the importance of this is the patient and how can I adjust, how can I put everything in a product that will be end user. Okay. So here, Daniela will continue the presentation.
So let's continue with this topic. The World Health Organization defines a wheelchair appropriate when it meets the user, environment, and needs. So we need to have all of this in mind. Also, it must provide proper fit and postural support, ensuring that comfort and security, also for the long hours that this user is going to use the chair. It has to be safe and durable. Also, it has to be available in the country and easy to maintain, and of course, affordable for the user. And to ensure all of this, is really important to follow these steps. Okay, the steps for correct wheelchair prescription is, as Giselle mentioned, assessment, selection, fitting, training, and follow-up. Okay, first we need to understand the user needs, then we choose the right wheelchair after that. Then we have to make sure that the wheelchair fits them properly. Then we need to train the user and the caregivers on how to use the product. And then it comes the follow-up. Okay, let's explain each of these steps. First, the selection. For example, at Law Medical, we use this clinical record, okay, to obtain all the information, all the important information of the user, such as age, the environment, the usage time, the distance, diagnostic. We also evaluate the motor and functional potential. We evaluate if the user has deformities, pressure sore, and also it's very important to have photos or videos so we can make sure that we are choosing the right product. And of course, all the measurements.
Okay, so here, it is very important that topic. Why data is important? Why? What do you think? Why is it important? Why? Because child, children, you have 6 months that prescription is fake. After 6 months, it's not a correct one because the patient is growing. So 6 months later, it doesn't work. Okay. The other thing, age, the same. In children, we have to consider more things on the how in the product, maybe the wheelchair, the walker or standing product, depends on the product, but it is the same. Age, it is very important because it said, okay, it's a child, so 6 months later, it doesn't work. I have to be another appointment, another assessment. And maybe the product have to grow with the patient. So it is important because of that. Environment, where the patient will use that term. Where? In
Rural.
plain surface. I don't know how to say it. A flat surface. And thank you. Or it's like a ground with rocks or something. So we have to consider what kind of wheels or casters. Okay, the other thing is the usage thing. Because depends on the use, you consider the cushion, the backrest, and the wheels. Because if the patient will use more than 8 hours, it will have to protect that skin, right? So depends on the environment, you will choose the correct product. The other one is the distance. If the patient is very independent, so we have to have in consideration what frame will be the best. And if the patient will use the power chair, how many amperes he will need, right? Because it depends on the distance, the battery capacity can change. The evolution is different that you have a patient now with a diagnosis, now with an injury, or the patient that was born with that diagnosis. So it is very different. And the other one is very important, motor and functional potential. All things you have to put it there. Because if you don't put that, I don't have the tool to imagine how is the patient. You know the patient, but I am not. And he's not, doesn't know. So it's very essential that you put all information on that prescription. Why motor and functional potential? Can the patient propose the chair, or use just the hand, or use just the head? It depends on that. I can configure the product, depends on the abilities. Then the deformities. Put everything that you see, because we have to consider the posture, the system, the postural system, according to all that. The other is the pressure sore. It's essential. It's crucial because depends on that, the life of the patient is risk. Aware the patient has that pressure sore. And the other one, as Daniela mentioned, is the photo. Because with the photo, I have all information. It's more real.
Okay, after the assessment, we have the fitting. Okay, in this step, it's very important that the wheelchair matches the user and not the opposite. So here we check the alignment, the posture, okay, all the important things. We need to make sure that the user is feeling comfortable in the wheelchair, okay, and safe. We made any adjustments if needed, and this step is really important because we can avoid evitar, ¿sí? Avoid future complications such as pain, pressure sores, or poor posture. ¿Quieres decir algo?
Maybe you gave a great assessment.
Yep.
But we are human. We can make mistakes. So when the product arrives, you have to fit always because we are not perfect. And it's wrong. So imagine that you can adjust. You cannot adjust it. Crazy thing, right? So every product delivery, you have to fit it and adjust everything to the end user. So that is the idea of that point.
Okay, after the fitting, we have the training. Here is very important because we have to teach the user and or the caregivers on how to use the wheelchair. Okay, we need to teach them how to sit safely, how to move in and out of the wheelchair. They also need to know easy, I'm sorry, I forget, basic maintenance of the chair. And this step is critical because also, I forget the idea. A ver, la voy a decir en español. Como que si no se entrena hasta la mejor. Okay, yeah, I remember. If we don't teach them how to use the wheelchair, okay, even the best wheelchair or the best product is not going to be effective, okay, because the user or caregiver is going to use it like wrong or incorrectly. Yes. Okay, and the last one is the follow-up. This is also important because it's not it's an ongoing process, okay? It's not just give the share to the user and then that's it. In this step, we can verify if the user or the wheelchair is still working properly, okay? If we have to change something like the backrest, the cushion, or any accessory. Also, we can make adjustments if needed. We can evaluate the condition of the user because the condition also may change over time. Yeah, I think that's and the growth exactly.
Yeah,
So
this is especially important with pediatric
yes.
patients because, as Giselle mentioned, in 6 months the user can change completely. So if they have a wheelchair, it's important to configure one that can last them, for example, 5 to 10 years. But you know, like a kid is going to grow up, so you have to keep doing this constant follow-up with the patient to ensure that they are always comfortable in their wheelchair, they always know how to use them, or the caregiver knows how to use the wheelchair. And basically the follow-up part is very, very important when it comes to prescribing a wheelchair and having a user be as comfortable as it can be.
Also, I would like to ask, I know John would like to ask something. We offer the adjustments with Laquis with our team, Mark. Back there, he's our technician. Woo! Yes, amazing. So how it works is after the patient purchases the chair, contact us if you notice, hey, something they have grown,
Exactly.
their head is not in the right position, we would like an adjustment. We will come to you or the patient, or they come to us, depending on which is more convenient. We do the adjustments with the OT or PT to make sure it's the adjustments based on what you recommend. So, and another thing I want to add is a lot of times we give wheelchairs to patients. They assume this is it. Their life is complete and everything is amazing, but they need to train how to use it. Sometimes the child doesn't feel comfortable in the chair right away, so you need to be there for the family and guide them. And maybe it's like 10 minutes at a time. Sitting in the chair every day is a little different. Tara,
what's the best practice follow-up for a pediatric case? So if the is going to last, if I remember correctly, the last 5 years, then are we trying to have our patients every 6 months, every year? Like, what's best practice? Because many of these patients,
yeah, in pediatrics, the idea is to check the
a child every 6 months. And in adult, we can check every year. So I recommend you give a warranty on both just for 3 years. Maybe it could grow more, but it's healthy. 3 years. It depends on the patient. We have children that grow so fast, but 3 years is the ideal. Why? Because you have their whole sitting.
We don't get 5 with the group.
Yes. So how it works is usually I would say recommend on the 4th year. Once you
see if we could do that option.
no, usually we already share with the growth kits.
Right.
So by the 4th year, you do your assessments, your measurements, and then you reach out to me. I'll get you a quote because to be honest, we know that these chairs are expensive and it's not as easy to purchase on a whim. So it takes about 6-7 months to purchase it. So I would recommend on year 4 to do the assessment. We get a quote, a general
Exactly.
quote for the growth. And by the time the family gets the payment plan ready, we do the assessment again.
That-
Make sure it's the right.
That would be the
assessment.
ideal,
That would be the
actually.
ideal situation.
Yes.
John, you want to say something?
Yeah, it's about the growth kit, and then usually if I assess a child, and exactly that funding piece is really tricky. So I would assess them again in 6 months, right before I give the final figures. We all recommend like continue
Down for 3 years.
3 years, every 6 months.
Every 6
yeah.
months for 3 years. And then
Like
every
that's a
year.
gap,
So
every
we
year,
will, it's a gap on our end, which we are going to start
Yeah.
implementing. And we are going to offer the assessment part free
Yeah.
for the patients. So we will do the adjustments for the families. Once we get a heads up, hey, we need to do adjustment, and we organize to meet with the OT or PT, whoever is doing it, and we will coordinate that.
Sometimes the adjustment can be a few hours long.
Yeah, it could be.
Yeah.
Yeah.
To make sure
Yes.
they have to leave really happy, fitted, really good.
We've had situations where we ordered the parts, it came, and it's still not the right fit.
Yeah.
So,
Anything can happen.
It's a long process. It does take time, but once you get the hang of it, and we have our great team, they always here for advice.
They video us doing some fittings.
Yes,
They're
correct.
always available, always successful.
Okay, ready. Thank you. Toca. Le podríamos preguntar a veces también cómo les hacen este proceso. Okay, so I want to do one more question. Sorry, I have my, Sandra, you're going to help me now. I have one of my clients here from Bonaire, Besker, so say hi. So I want to know also how you do all this process, if you can share with us, like all these steps.
We are following those steps because the house visits, they connect the wheelchair, and then we are going to the house client and select the steps client, and what their goal is
Yes.
the wheelchair. Once the
Ah,
wheelchair arrives
yeah.
there, so 6 months we do that.
Yeah, that's the other thing that sometimes takes change, like making the wheelchair and then arriving to the destiny, and then it's a process.
And when it arrives, we are going other OTs because they are doing the training and
Perfect. Yeah, I remember when I visited you, we went to feed some clients. Okay, thank you. Continue with the topics that you have in the agenda. We can continue with the clinical, anatomical, and postural basis. So here, I want that you participate with me, because it is monotonous that it's just me talking and talking and with bad English, but talking and talking. So now, pelvic positions. One of you, who wants to be my model? Not all of you, just one. One. Cool.
Anybody? Yeah, do we have
Yeah.
prizes, by the way?
Woohoo! With a chair, with your chair, please. Yeah. Okay, here. Please take a seat. So we have the neutral position, right? Is the best. Oh, ideal, but it's not the usual that you see, right? So in this case, what is the posterior tilt? Could you do it, please? Posterior, yeah. That is the posterior. See it, see her. Ah, it's
Which one we want it for everyone here?
yeah,
Do it for everyone. And
everyone here. No, but here it's okay. Look, yeah, posterior tilt. I sorry. Okay, the posterior tilt. So if you want to stand up, so be free to do it. So that is the posterior, right? So the pressure is on the sacrum. Maybe most of the time it's on the sacrum, right? It's the most common position. Actually, some of you are in that position. It's very common, right? And the other one is anterior tilt. Maybe like J-Lo, like this. Okay, it's less common, but you can see that. So now here, and all of you, please sit in a neutral position. All of you, sit in that position. Yeah, maybe as yellow, a little bit. Okay, and now, how many times you see, okay, a standard wheelchair? Not a standard. We can do it better, putting, I don't know, elevating leg rest, right? It's better. It's not just a chair with wheels. It has elevating leg rest. Or you have a tilt product, and then most of the time I see you prescribe elevating leg rest. So now in that position, all of you, like J-Lo, okay? Please elevate your legs. Yeah. And stay there. Elevate. You can move. Okay. Now you feel like straightening here, right? Pain. So please do a posterior tilt of the pelvis. It could better, right? It is better or not? Is it better? Yeah. So now, thank you. You are stimulating with elevating leg rest to the posterior tilt. Is it correct? No, right? So why you prescribe elevating leg rest without reclining backrest? It's not biomechanical movement. It's not correct. Because of that, you are straightening the muscles, and it produces pain. So it's not correct. It induces or promote the posterior tilt, and it is a not correct position. Why? Thank you. Applause. Why? Because in the posterior, you can see here, the anterior pelvic position produce a hyperlordosis, right? It's not correct because we have a structure in our spinal cord that has the curves. If you increase that curves, it's not correct. Why? They are the spinal, how can I say sí, en español se me olvidó. I forgot in Spanish too. Columna de la médula espinal. Spinal cord? No, spinal cord no. Médula espinal, how can I say? Spinal cord injury? Okay. So if you have the spinal cord injury, you have the spinal cord, right? So it is the communication between brain and everybody, our body, right? So if you have more curves than the normal, maybe you will have the pressure on nerve ends, right? So it produces pain. It produces maybe sensitive problems or sensitive issues. And then mobility issues too. So if you have the pelvic, posterior pelvic tilt, it is related with the kyphosis, right? Kyphosis or kyphosis. So hyperlordosis and kyphosis. It is more common and it's usual to be, but it's not the common position that we see. So here we have the other posture, is the obliquity. What is the obliquity? One pelvis is up and the other one is down. It's not the same with rotation. It's just up and down, right? But if you have that, maybe you will produce or you will have this scoliosis. Actually, it's very, very, you have to sign that because it would be. So then you have the pelvic rotation. Is one more forward and the other backward, right? So you have this one. It's very common to see that different distance in the femur, different distance. See? Yeah? So, but it is not that femur is has less length than this. No, just the position. So it's related with the rotoscoliosis. You have scoliosis and then rotation. It is very common. In all the patients that you have with a lot of contractors, it's very common, the rotation. So most of the time, the pelvic rotation is related with obliquity. Both are related most of the time. So you have the deformities on the pelvis. You have the posterior pelvic tilt, the anterior pelvic obliquity, rotation. Fixed pelvic deformity is another, and it is rare to see it, but you can see that deformity on the sacrum and on the ilion. And then the sliding or sacral sitting is very common with the posterior tilt. You are sitting on the sacrum.
You see pelvic obliquities when they're lying down on
supine?
table, yeah. Can you also,
Oh, we have a
yeah. I also remember that is usually we do it in the chair, but you can see it as well.
Yeah, I can, but can you see me? Come here. Or I don't know. I try to. Ayúdame a correr. Ah, bueno. Hey, Mark. Thank you. Thank you. So here, thanks. You have that. You have the posterior tilt, right? The anterior tilt, then the obliquity, then rotation, and the mix. But if you have this in sitting, it's fine. It's good to see it. But in supine, it's difficult to see. You have to move. I actually be my patient, please. You have to take the pelvis and move it. Most of the time, if you have the obliquity, you have this. How I don't know if you can see it, but if you can stand up, so it's that one up and another down. Es cierto. It is true. Okay, right there. Yeah, and the rotation, you will have this. So you try to put it down, and it doesn't work because it is fixed. Maybe most of the time it is fixed. Yeah. So you can see that. So you have to move. You have to move that pelvis, and you can touch the flexibility. But always do that before the assessment. We will see it later with the assessment, but it is important to move the pelvis. Yeah. ¿Otra vez? Again, ¿qué se hizo Gismark? Speak slow because.
Would you recommend for them to assess lying down or seated?
Both. Both. No, both. You have to do both. And actually, I recommend you, first of all, I don't think what deformities or what is the posture of the patient. I just need to move. First, move as possible as I can, as possible as the patient permitted me, but you have to move, and then you actually you have to let him move, our stress or be contractor and everything. You have to see every position of the patient, and then when you move, and then okay, he or she is relaxed, and you can move, and you can taste, and you can put that movement, and you can diagnostic the situation on the pelvis, on the spinal cord and everything. But you have to move that. Okay, here you have to see that if I have contractor here, he can move or not, or yes or no, it's fixed. Oh my god, I have to be I have to have that in my mind to the assessment. Okay, I need, for example, 90 degrees on the leg rest, not 70, 80, 90, 95, depends on the situation of the patient. But is it clear? I answer you? Yeah. Okay. Thanks.
So it's good to have the bed because a lot of situations you
Tara?
don't have it.
I have a follow-up question. So, how do you assess without compromising quality of care? Fully, properly, like totally. Because the last time I tried, because I felt like I was influencing my money because it takes effort to restrain or like they have no
Yeah.
strength. So is it that then you sacrifice or not sacrifice? You say okay,
No.
you're lying.
You have to
But you still do the
respect
sitting.
the limitations. You have to respect that. If you, for example, has that patient that posture like this, and you want, it is a big error that we do, is trying to put it in a correct position. It's
No, but that's
very
not the
wrong.
case. It's that in order to take a seat measurement, you need to restrain. Like literally, they were
Yeah.
on a chair.
In
So at some point, you are sort of manipulating the positioning, no matter what you do. Whether you tell mom hold your shoulders or whatever you're doing to get the measurement, it's artificial.
actually,
because
you
it
need
has
you need
nothing to
help.
do.
You need help.
Yeah.
You need
So you
more.
so you do hold them in.
Yeah, of course, because you would put that patient in a chair. So you have to use your hands on the hands of the parents as a support that you will need on the product. So if you have that position and the patient collapse, and you will need the help that making that, you will have a support here. Is the parent, is the mother, is the father, I don't know, but is the caregiver. So you will have that, you will need that support. I don't know if I am explaining what. Yeah, but you have to put the patient in the best position, but with considering their limitations, his or her limitations. But for example, most of the time they say, oh no, here, also, in a neutral position, but it is not real. It's not real. If you consider their position, and when you put the patient on the chair, he doesn't like the chair. He cried and cries and cries and cries and doesn't like it. It is a bad habit that we used to do. But in that idea is most sometimes I have to take the measurements supine because it is impossible. I don't have the help that I need. So most of the time I take, most of the time, sometimes I have to take in supine because I need to see what is the distance, what is the measurement. But I prefer to put the patient on the posture that the patient has. For example, posterior tilt, and he is there like this. So I have to take the measure here like this because when I put the patient on the product, he will be like this, not like this as I wanted, but he'd be like this, correcting and preventing some deformities. But I have to respect that limitations. Is it clear?
I think when the two clients come later, you have a nice example.
Okay.
7-year-old has spina bifida.
In a real life.
Yeah, you see hands on.
So just whoever's asking questions, please live stream once you also speak louder.
Okay.
so they can hear your questions.
Okay, so now you have flexible or rigid, right? You have fixed or flexible. How do you know that? Moving the patient. Moving. Your hands is your best tool. Is our best tool. Nothing, nothing substitute our hands, nothing. Our hands are the best tool. So, for example, we have a simple, this simple test that we have to do in the column. So you can see the HIVA. I don't know how can I say that, HIVA. HIVA, like a prominence on the back. Yeah. How do you say that? HIVA? Jiva? No? How do you, ¿cómo le dicen a la prominencia? ¿Cómo le dicen? How do you say this? No, scapula, no, that prominence. Hum. Hum is HIVA. HIVA or hum. So it is an indicator, it's sign of fixed, a fixed. Yeah, you have fixed there. If you move the leg and it has limitation, it's a proof of fixed situation. When you see that, la voy a estar usando. O corremos la silla. So if you see this, maybe humped, right? It's very common, hump, right? I learned a new word. So here, you can see the deformities on the spinal cord. You have high thoracic, lower left lumbar scoliosis, mid thoracic, right? Remember, what define the name or the right or side, left or right side of the scoliosis? What? The convexity or concavity? What? Which one? Convexity? What is convexity? In a curve. Where is the convexity here? Here or here? Where? Okay, raise your hand. Here. Raise your hand. Who thinks that this is the convexity? Oh, nobody. And here? All of you? All of you? The other one. Okay, again. Here, convexity. Who? One. Brave. Good. And who thinks the convexity is that one? Nobody. Okay, you. Brave you too. So the convexity is this one. Yeah, it's this one. So if I have an scoliosis here, what is the convexity? What is the scoliosis? Right scoliosis, right? And maybe thoracic or lumbar, but it's a right scoliosis. Yeah, right. My right. Your left. Yeah, here. Convexity is my right convexity, right scoliosis. Okay. So you could see compensation. You have here like an S, right? It's very common or not? It is, right? So when you have the necesito la camilla. O una silla, no. Bueno, es que me veo mejor en la camilla. Mejor la dejamos acá. So if you have posterior tilt, you will have scoliosis, kyphosis, right? You have anterior tilt, you have hyperlordosis. When you have obliquity, scoliosis is typical. If you have rotation on the pelvis, it is associated with rotoscoliosis. Okay, it is all of our associate. So the pelvis is our base. when you start moving the patient or evaluate the patient, always start with the pelvis, always, because the pelvis is the base. The pelvis command spinal cord, command legs, command head. Pelvis is the base. So our focus start on the base, on the pelvis, okay? Then you have these situations that are associated with the pelvis posture. It is luxation, right? Luxation. What is subluxation? What is luxation? How can I? I say something wrong? Something vulgar? Oh, okay, luxation. I said like, oh my God, because for example, it's not my native language. So I said, oh, you have to be focused. So it's a complicated word, but you understand, right? Okay, luxation, subluxation. What's it? What it is? This is the femur, okay? Acetabulum, you have this, right? When you move this or you don't have the movement, you could lose that form or that design of the pelvis, and then you have this is a subluxation, and then luxation, right? So what happened? You could see one leg smaller than the other one, shorter than the other one, right? So, but it is not real. The femur is the same. It's the same length, but you see different because of that. So it's more. It's very common to see that. It's very common to have luxation, and most of the time it's unilateral, not bilateral. If you have bilateral, poor of the patient, but in regarding posture, will be more similar. But it's always related with that. So that it is related more with the rotation than with the obliquity. It's more related with rotation than subluxation and luxation. Then you have the skin assessment. Oh, it's very important. We will see it next, that you have some steps that you have to evaluate in a patient before take the measurements. One of the thing is that evaluation that we did, and the other one is the skin, evaluation of the skin. So because why is skin is very important? No, it's the most important that you have to consider. Why? Again? Exactly, pressure sores. So if you don't consider that, maybe you could affect the patient for the rest of her life or his life. And it is crucial for their lives. You could kill something. Imagine your responsibility. If you can consider that, you can kill someone. It is, I know it's rude, but it is real. And you are signing that prescription, that assessment. So in the future, when someone looks like that patient and then sure, who prescribed that? Who? And I like, I don't know. But your sign is there. So because of that, it's very important to do it as better as I can. See? So the most common places that you can see this pressure source is on the prominences, right? The bones. So here, our ischiatic tuberosities is like, I am flying. Okay, you see that. The other one is the crest. Yeah. The other one in the spinal cord, the prominence here. Exactly. So other place is, I couldn't imagine, but it is common here. When you choose the incorrect length, you could produce that. Most in spinal cord injuries. But it is important. The other one is the heels. and the scapula and head. So that is the points in a product. So here is typical wheelchair position, right? It's typical. The one leg shorter than the other, scoliosis, rotoscoliosis, one head here, one shoulder down and the other one up, right? It's very common to see that, or not. Not in Trinidad, just in Costa Rica and in Mexico. Okay, so the other one is the windswept. It's good. Windswept. Woo! I am flying. I am bilingual now. So windswept, it's very common. You have this, and what is here? What could you see here? One of you. You can see one position. Obliquely. And the other one, rotation. One leg shorter than the other. Visual. One leg shorter.
You say it a little louder.
Louder.
No, the positions.
Okay. Here. So you have this. So obliquity, rotation, one leg shorter than the other one. Scoliosis, rotoscoliosis, lateralization of the head, everything, right? It is very usual to see that. So here, that is a real patient. So here, you have contracture on pelvis and on the knees. Most on the knees. It's very common. Because most of the time, the patient is on the arms of the mother. Here, right? Or on the sofa. It's best. It's the best. Or the bed. Worse than the sofa, I think. They are fighting. Who is the worst? So you could see that. Windswept, one leg shorter than the other, but it's luxation. Here, hyper abduction structure is fixed. Then you can see it here. So rotoscoliosis, windswept, is very common. Mega, super rotoscoliosis. And here you can see the imagine of that. So what is the resulting alterations in physiological alteration? Breathing, of course. We have whole organs here function in a position. When you move that organs, maybe it doesn't work properly. They will have problems with feeding, with digestion, swallowing, and bowel movements. It's very common to see that, right? Because of that, they don't have movement. They are in the same position with the organs in another positions inside. So a lot of things that you can prevent or you can stop the progression of that. The other one, you will see that limitation on society. They are very retracted. Yes, I know that. And functional, of course, functional limitations. If you have a patient that could be active or independent, and you don't put the correct postural system, you will be in problems. Because you don't provide him or her the correct product to be more active and more independent. But today, we will practice with this, and I hope you will be the best. So the other one is foot deformities, echinus, varus, valgus, pronation, or supination. Pain, fatigue, is it okay? And sitting intolerance, it is very common. And shoulder injuries, most on the active patients. Most of the time we evaluate it, as I will said, can you propose the chair? Yeah, okay, like this. Okay, but you can put the wheel, the big wheel with the handrails and do it, go. It's not the best, maybe. Maybe we'll need more than this. So everything we have to consider that. So most common pathologies, we have more, of course. We have a lot of pathologies, but it's more common amyotrophic lateral scoliosis. What is that? Do you remember? HELA, ELA, ELA is amyotrophic lateral sclerosis. Do you know what is that? No? El actor que murió hace poco de Grey's Anatomy, the actor of Grey's Anatomy has that. Everything knows Grey's Anatomy, right? And the handsome man, right? So they have that. It is very complicated diagnostic because the prognostic or forecast of life is very limited.
John had a client with ALS, and she got him measured for a chair, but he was so down about his sickness, he refused to get the chair.
We tried.
He had,
Yeah,
he was depressed, and he said,
yeah, it's
he
complicated.
just accepted.
But in
he
these
would not get it.
cases, what kind of product do you recommend? In this case, what product did you recommend him? What? What product?
The motorized.
No, it was ECP.
It was easy because we wanted him to get a balcony close to his room, so we wanted him just to be able to sit and go outside on the balcony.
Okay. In this case, I recommend you that you know the limitations, you know the forecast, right? You know what happened with that patient. So in this case, think more in power wheelchair, because why I have to, maybe he or she has just 1 or 2 years. Why a manual? No, this better power. Because I know as a professional, I know the diagnostic. I know the forecast. I know what happened with that patient. So if I know, why I recommend a manual. Just if you consider a tilt, just in that cases, because the patient doesn't want, is very depressed. In those cases, it's okay. But most of the time, we recommend a power wheelchair. The other one is multiple sclerosis. Is different. It's an sclerosis, but it is different. Why is different? Why? I know you want to say that. What's your name? I know. Mine. I need the glasses. What is your name? Yeah. Okay. You.
You can speak louder.
Oh, sorry, they're able to use the arms to the floor using a propeller self.
Yeah, they suffer episodios. Yeah, episodes. They have some complication, muscular and nerve. So it's a combination. Depends on the sclerosis. The scenarios could change, but it's complicated because of that. But the patient could be more functional and has better prognostic, right? The other one is cerebral palsy. It's most common, but we have a lot of classes, right? The other one is muscular dystrophy. What is that is difficult because sometimes we said patient can move, so active or autopropulsive manual chair. Yeah, but what are we doing? Healing the fibers, killing the fibers. So it's not good. You know the diagnostic, you know the prognostic. Why you recommend a manual? It's not good. A power chair is not privileges. It's a right. Remember that. Yeah, it is more expensive, but it is that the patient needs. Why we have sometimes fear to prescribe that. Why? Because the price? No. Remember, we are based on the patient needs, actually on the patient desires. So if you know that patient fatigue, you will kill that fiber. Why you recommend a manual? It's not correct. The correct one is the power. And I can conserve that fiber for the future and give them more lives, right? The other one is the stroke. It's very common. Hemiplegic situation, right? But they can be functional. They can be independent. We have the one on drive. Do you know one on drive? Is double hand rim in one side, and you can move both wheels with one hand. But most of the time, and it's very common, it's very, very common that the patient moves the chair with the leg, not with their hand. So mix that or combine those things could be the best. So the patient could use the leg and then use the hand. Both are correct. So you have to configure the chair very low. But with the hanger, with the leg support, with a specific angle, maybe 70, because we have distance between the ground and the foot plate. Amputations, arthrogryposis. Do you know what it is, arthrogryposis? Who can explain that? Arthrogryposis. Maybe Besker? Someone? Arthrogryposis, do you know that? Is a congenitive diagnostic. You know what is? No, it's like no, I don't want to talk. Okay, it's congenitive diagnostic, and the patient has the fixed articulations. So most of the time is the elbows. Stiff. Excellent. So knees on the elbow. So you have that limitation, but some of them can walk with limitations, but they can walk, or they can propose a wheelchair. But depends on the limitation. They could be more independent or not. Traumatic brain injury, you know that. Spinal cord injury in all the levels. And osteogenesis imperfecta is brittle bone disease. Do you know that? The glasses people, I think. Is the same? Yes? Okay. So here you can see cerebral palsy, different kind of levels. Muscular dystrophy. I didn't mean. Sorry. Muscular dystrophy. So see this. How can I go up here? It's very common on dystrophy see a lot of deformities because that hypotonic that produced that. So one thing that it is very particular on muscular dystrophy is that they have the sensitive elevate. So they feel everything. They feel that they feel everything. So you have to consider that on what cushion will prescribe, because depends on that he or she tolerate the sitting or not. So because they have the sensitive very high. Here, multiple sclerosis, amputee, arthrogryposis. See that? Traumatic brain, spinal cord injury. What is our objective here today in our training? Mobility and independence. Mobility as I can to provide and independence, the same thing. So here we will see a lot of things, but we just have one day, but we will do the best. And here Gismar continue with the presentation. Any question regarding anatomical or clinical? No. Okay, single breaks. Yeah, we continue with the break.
Yeah, we know we saw a lot of topics right now, so we're going to go ahead and have a 15-minute break. Bathroom, water.
Lo terminamos antes.
Feel free to take a break and we'll start at All right. Thank you, everyone, once again for your attention. We hope you had enjoyed your snack break. I am going to present myself again. My name is Luis Mark Lopez. I am a biomedical engineer and I'm currently serving as the sales rep for LOH Medical here in Trinidad. And right now, we're going to talk a little bit more about types of frames, materials, and different types of wheelchairs. It's a little bit of a more specific topic and more technical because we're going to be talking about materials, etc. But it's also very important because it's part of the cycle of prescribing a wheelchair. Besides from taking measurements and knowing about the user, you also need to know very much a lot of information about the wheelchair that you're going to be prescribing, specifically what materials you should recommend, what type of mobility the wheelchair is going to provide, what kind of accessories you're going to add. So this part of the presentation is going to be focused a little bit more about that. So when talking about materials of wheelchairs, currently in the market, there are about 5 main materials. Most of them you probably know when you're prescribing a wheelchair, for example, steel or aluminum, stainless steel, carbon steel. So these types of materials are very important to know because they have different types of characteristics. For example, when I was studying my career doing biomedical engineering, one of the main topics that we studied was material types because, for example, steel is very different, for example, to carbon fiber. They have different characteristics. And when you're applying these materials to the wheelchair, they're going to provide different types of functionalities to the user. For example, one of the main materials you see right now in the market for wheelchairs is carbon steel. One of the main characteristics this material has is that it has currently a high strength. So it's gonna be more durable over a long time, specifically if you take into consideration that a user is going to be going through, let's say, walking, or I'm sorry, not walking, but like using the wheelchair on a type of, how do you say, a street that's going to be a surface that's going to be more robust. So you may consider using or prescribing a carbon steel. Another type of material that is very common is aluminum, and aluminum is very interesting because currently there are a lot of advancements in technology with aluminum, and the main one was 6,000 or 5,000.
We have 6,000 and 7,000 gold alloys. So depends on the number, is the features of the material.
Yeah, one of the most important characteristics of aluminum wheelchair or aluminum as a material is that it is very lightweight. So if you have a user that is very active, it is most usually common to prescribe an aluminum wheelchair because since it's lightweight and they have mobility in their arms, they can push themselves very easily in comparison to a steel wheelchair. That a steel wheelchair is going to be obviously way more heavy. Titanium is another material that is very common today in the market. However, it is important to know that it could be more heavier, but what will be the main benefit of having titanium is that it's corrosion resistant. In fact, when I got off the plane yesterday, the first thing I felt was the humidity here in Trinidad. And as you know, over time, if you have a wheelchair that is going to be exposed to the weather, this corrosion over time is going to degrade the material. So you can consider in countries like Trinidad or in the Caribbean in general, that the temperatures are going to be way more humid. Well, you may consider to have a titanium over steel or other types of material that over time are going to degrade because of the weather.
How would you recommend to clean it? Because we get a lot of sea blast, particularly in Tobago, Barbados, Jamaica here too. So how would you recommend to clean the wheelchairs?
Yeah, since Trinidad is basically an island, you know, the sea is very salty and the winds are going to be carrying the salt and going to be attaching themselves to the material of the wheelchair. It is very essential that you try to clean it with water, just straight up water. Make sure it's not from the ocean, of course. You grab a damp towel with water and make sure to clean the frame of the wheelchair. I would say, yeah, do not spray it with a hose. Make sure you grab a towel and you wipe the wheelchair down every week or so to avoid corrosion over time.
And no WD-40.
Yeah, no WD-40. And make sure you're not spraying WD-40.
Yeah.
Yes? Oh, the question was how often do you recommend to clean the wheelchair? Specifically here in Trinidad, that is very close to the sea. and that, you know, the sea is salty and the wind's going to carry that salt and it's going to attach itself to the wheelchair, we recommend that you clean the wheelchair, let's say weekly, with a damp towel with potable or drinkable water that is not salty, because if you keep applying salt over time, the corrosion is going to damage the wheelchair. So that's a very good question, taking into consideration that there are different parts of the world that are going to have different types of weather. So you have to consider the type of material of the wheelchair you're going to be recommending, right?
Mucho más que la toalla húmeda es tener una escobita y remover el polvo de la cinta, porque a veces la toalla húmeda puede correr. Entonces, usar la escobita y verificar los vellos.
Yeah, another important thing about cleaning a wheelchair is not only just grabbing a towel with water and, you know, cleaning it. You also got to make sure you have a brush. The brush is going to be very important because you have to get the dust out of the wheelchair, because over time that dust can damage the movable parts. For example, this wheelchair has both a reclining, the recline is here, the reclining function, and it has a tilt function. So let's say over time you're not cleaning it and dust is getting in all of the parts that are movable. What's going to cause if you're not cleaning it? It's going to make the movements are going to be rougher. For example, instead of having a cleaner recline, it's going to be crackling. If it's very dusty, it's going to sound like, you know?
In those cases, don't use WD-40.
Yes.
Use grease. Use grease. Yeah, but a little bit.
What about what if you have hair in the wheelchair?
The wheels.
In the wheels.
Yeah.
The wheels and the pistons.
So another problem that you see.
And another thing, it's a tip. You have aluminum here, right? But you have the screws and knobs, and they are steel. So in this case, use a Vaseline. Put Vaseline on the screws, and you will reduce that corrosion.
Yeah, one of the main mistakes people have when they're doing maintenance in a wheelchair is thinking that WD-40 is going to solve all of your problems. Well, WD-40 works in other things, for example, as doors, hinges, etc. But when you're treating a wheelchair, you cannot just spray WD-40 everywhere. You have to make sure that every part is greased correctly using grease, or as Giselle also said, the movable screws, they can be greased up with Vaseline. So make sure you are applying the correct products to clean the chair. And as I was mentioning, use a brush. Make sure to get the dust out regularly, maybe every 2 weeks or so. Also cleaning with a towel, as I mentioned, you can do that weekly, especially here in Trinidad because of the weather and the humidity. Also, another important thing to note are the wheels. I guess most of you have gone to a hospital and seen the transport wheelchairs, and they never clean them, right? They can be on the hospital for like 10 years and they have never ever cleaned the wheels. I used to work in a hospital before and as a biomedical engineer, and one of the roles that I had to do was cleaning basically the wheels of almost all of the medical equipment, especially wheelchairs. And you cannot imagine, yeah, you cannot imagine the amount of hair I had to pull out of wheels. So the wheels are very important because they're the basis of the mobility of the chair. So make sure you give an inspection every 2-3 months, or as commonly as you can, because that's the basis of the mobility. And I can tell you that the amount of hair and dust that you can find on the wheels over time, you can fill up basically a whole gallon of hair. It's crazy. Yes. So make sure you clean that. Also, yeah, Mark.
And grease. Vaseline on the screws. Here, for example, you have the piston or the tilt mechanism. Maybe you could, it's WD-40. No, just use that. No, but you can use it. If you have like
Very stiff.
very stiff, and you like, maybe they are. Hay un taco ahí. How can I say that? Un taco de
Something stuck.
something. So you put WD-40 and then grease and put grease. Always. So
Grasa.
WD-40 is just to clean. Just clean a lot. And that is the mistake.
because you use WD-40 for everything, and clean that grease that it is very important. So then use the WD-40 and then clean and put grease. Not a lot of grease because it could be another mistake. Put a lot. Put just Vaseline and grease is different things. Vaseline is on the screws and grease is on the pistons and the marca. No, I recommend a white grease.
White grease.
I don't know brands. I don't know brands, but white grease. White grease. Not liquid.
¿Qué cosa? Te me da nervioso. The screws with Vaseline and white grease or like mechanical grease, that's usually how they sell them in the shops. For all of the moving parts, for example, the rotation angles, the pistons, you can use mechanical grease for that. Industrial level grease.
Yeah, of course. All the technicians, they have the knowledge and don't be creative.
Yeah, as you can see, a wheelchair has about 1,000 movable parts. So maybe you think, oh, I can fix this by myself. Don't do that. Always go to somebody that is an expert on the topic, a technician like Mark, and they can determine if it needs specifically grease or it needs a replacement, because sometimes you may just look at a problem and say, okay, oh, I can fix this by myself. Try not to do that, because when we're helping the lives of users and patients, it's very important that everything is working perfectly. Somebody had a question. Yeah, go ahead.
The warranty of the frame? So we offer 1-year warranty on the frame, the mechanics, the cushions, 1 year on cushions, 2 years.
2 years.
On the cushions, but the fabric, I don't think there's any warranty, correct?
No, the fabric depends on the
Dutch. But
Okay.
you have like scratch.
rips.
If you have that, that's warranty. But if you see like the patient doesn't
Take care of
Care.
it. So wear and tear,
Perfect.
natural wear and tear would have no warranty. So what we would recommend is always call us. We could then reach out to the supplier. From based on the supplier's feedback, we could confirm what is or what isn't under warranty. But natural wear and tear, as in the rubber on the wheel, I don't think it's under warranty, correct?
No, that is
Correct.
because of that. It's very important. Every year, at least, recommend a maintenance of the product. Because, for example, in power chairs, when you have some stock on the wheels or the casters, you could reduce the motor function and the potential of the motor, so you reduce the motor life. So it is very important to check that. Always, right, Mark? The heel.
We see a lot of here in casters and in wheels. So to remove that here, I use like a dental pick to pull it out, but you probably use like an ice pick or a knife, because that here collecting like you is very prominent and cause a lot of
Yeah, it's very important that you brought up the warranty, and specifically in most of the cases, and you can talk to Christy or the Laquis team, and we look at the warranty issues to a case-to-case basis. So maybe you think, oh, this will not be covered by warranty. Well, you can come to us. We'll look at the case specifically, see what happened, and most of the times there can be some type of solution. So besides the time frame, for example, 1 year for the frame or 2 years for the cushion, talk more about what happened to the wheelchair, what happened to the cushion or to accessory, and the warranty cases can be solved one way or another. There's usually not many times that warranties are declined, because, as you know, the wellness of the users is very important. So talking back about materials, another material that is very high end will be carbon fiber. Most of you have probably heard it, I guess, in cars, right? that if a car has carbon fiber, it's going to be like the most high end and the most exclusive one, right? This is because carbon fiber is a material that is relatively new. I would say it has been around for about 50 to 60 years. And this material is very prominent because it's super lightweight and super durable. And there are wheelchairs that are coming out with full carbon fiber frames, but they tend to be more expensive because of this. It's one of the most expensive materials because of its quality and the things it brings to the table. So talking more specific about the materials, as you know, steel wheelchairs, they're going to be most of the ones you see, for example, in hospitals, in transport wheelchairs. They're the classic ones that you also see in the airports, hospitals. And steel is super cheap. It's very economic, and this is why you see it in most of the wheelchairs that are in public spaces. They are very robust and resistant. That doesn't mean that it's a bad material. Steel is very good, but one of the drawbacks that it has is that it's very heavy. If you try to go to a hospital and grab a steel wheelchair, usually you cannot do it by yourself. You're gonna need the help of another person, right? Because this material is very heavy. When it comes to stainless steel, it's one of the ones that you see in, for example, here in Trinidad, because as I said, stainless steel is a material that is very anti-corrosive. Over time, it's not gonna corrode and be covered in rust because specifically this alloy has this quality that prevents corrosion over time. Also, it is very durable. It's basically the same components as steel, but it's treated and coated with special characteristics and chemicals that make it stainless. So over time, it's gonna look pristine as long as you take care of it. That's why it's very important to make sure you do the regular maintenance of the wheelchair, cleaning it over time, etc. Then we have aluminum wheelchairs. That this is the type of material that you usually see when it comes to more active wheelchairs or people who need wheelchairs that are very lightweight and very easy to transport. Aluminum will be the material that you will try to recommend for this type of active users. Then titanium, they're going to be some of the lightest wheelchairs in the market. However, as you go down to the other characteristics, you make it more lightweight, more durable. Of course, it's going to be a little bit more expensive, but you have to take into consideration what are going to be the user needs. For example, you may not want to recommend a titanium wheelchair to a person that has very low mobility because it's not going to make sense. So always make sure to take into consideration what are going to be the user needs. And parting from that, you can start thinking of, okay, maybe I need to recommend a stainless steel wheelchair. If they're very active, well, they can have an aluminum wheelchair and so forth. And as I said at the beginning, carbon fiber is going to be like the top of the line, the best material you can have, but it's going to be way more expensive. So talking about types of wheelchairs, as you know, there are a lot of type of wheelchairs. You have the transport wheelchairs, as I was saying, that you see in hospitals, airports. You have active wheelchairs, like the one over here, that you would recommend to a patient that has mobility in, and this is stainless steel, right? This will be aluminum. This will be an aluminum wheelchair. So as you can see, it's very lightweight. I can pick it up with one hand. We also have tilt in space wheelchairs. These are the types of wheelchairs that have two very important functionalities. The backrest can recline, and they also have the function of tilt. That's why the name comes tilt in space. So if you take a look here at this edge right here, yeah. Besides the recline, sí, le pusiste el otro aquí. There you go. So besides the backrest can recline, the chair can also tilt in space. So who do you think you would recommend this type of wheelchair to? Somebody who wants to take a shot at it? Exactly. Users that have neurological conditions that they're going to need a caregiver to have this mobility. It is very important because this tilt mechanic is going to allow for pressure to be distributed in many different ways. For example, if you have the user sitting down in this position for about 6 hours a day, most of the pressure is going to be in this area, and over time it's going to hurt. So what you do is you can recline the wheelchair, you can tilt it, sorry, and that pressure point is going to be now distributing to the back. So when you have neurological patients that are going to need this type of support, these types of wheelchairs are way more reliable. Oh, yes. So as I was saying, you can recline. Let's start to recline. No, you can recline the backrest.
But you can choose. If you don't want reclining system, you avoid it.
And you can
Just
also tilt the angle like this. And you can totally mix and match. So depending if the user feels more comfortable with a little bit more reclination in the backrest, you can do that. They want a little bit less recline, you can up it, and also the tilt of the wheelchair, you can change it.
My question.
Yes.
The tilt, that tilt mechanism, any requirements for like duplicating that or just keep it the same white grease?
Yeah. If you see here, this wheelchair in particular, the type of reclination that it has, you can consider it to be on a rail. I hope you guys can see over here that it's basically like a rail in form of a half moon. So the edge of rotation of the tilt will be on that rail. Yeah, we're going to see this a little bit more forward in the presentation.
We have different types of tilt.
Yes.
One is with rails, or with pistons. So later we will see the difference. And why or when we choose one or
Besides from manual wheelchairs, we also have powered wheelchairs. These are the ones that have a battery and they can be controlled using a remote controller, usually also considered to be a great option for neurological patients that are not going to have the arm mobility to propel themselves or do not have access to a caregiver all the time. Sometimes it's better to recommend this type of powered wheelchairs because they can move themselves and they have more autonomy over time.
actually you have the possibility here with the hires with this system, put the power to it. So if you have a patient that cannot propose or propose the chair but needs that kind of tilt, maybe if he wants to make it by himself, they do it with power. So it is a reduction on the iris.
Also, we don't have one here to show, but I can point it over here. These are more athletic type of wheelchairs. I don't know if you guys have seen the Paralympics. They happen every year. Those are the types of wheelchairs that you're going to see specifically in competitions like in basketball or in sprints. This one too, those are like athletic types of wheelchair because they have different types of characteristics. For example, the angle of the wheel, as you can see in these type of wheelchairs, turn way more inside. This allows the user to propel themselves and go faster.
I have a question. We've had customers wanting to buy this wheelchair for athletic reasons. Can it work? Or you not recommend
It's not
it?
the ideal. It's
Okay.
not the ideal because it doesn't design.
It's not designed, yeah.
Yes.
It's not designed to do that.
Okay.
It's designed to daily use.
But can it be used if
Yeah.
they can't necessarily afford those?
Yeah, but it's not
not
ideal
ideal.
because
Okay.
maybe put that wheelchair in risk to, I don't know, break the frame. So
Then it just void warranty if they use it for enough reason.
it's not
Okay.
It's not the function of that chair.
Okay.
Yeah, so if you have a user that is going to, for example, be an athlete, they're going to play basketball or they're going to do marathons, you're going to have to consider if they are going to have a wheelchair specifically for sports and then also another wheelchair specifically for daily use because they're going to have different characteristics that may complement each other but may not be used correctly. So always make sure what are going to be the user's needs, specifically when it comes to these types of wheelchairs that are way more designed for sports.
Sport chairs you can have for beginners and for adults. We have both. So the price is different. Sorry, what did you say? If you're a beginner.
Yeah, they usually the higher.
To repeat the question.
Oh, to repeat the question.
Yes. So no, repeat the question so everybody can hear.
Oh, the question was if what type of material would you see in these athletic type of wheelchairs? And the higher end, the ones that you're going to see in professional sports, they're going to be carbon fiber because carbon fiber is going to be the most lightweight and most reliable, durable component, but they can also be aluminum usually.
Aluminum with carbon components, but it's aluminum.
Yeah, you can see the combination of aluminum and carbon fiber or fully carbon fiber. That's going to be like the most top of the line wheelchair you can find for athletic uses. Going to talk about a little bit more about the types of frames. As you know, there are two main types of frames in wheelchairs. Somebody wants to say which one of them, for example? This one right here. Yeah. Can anybody tell me what type of frame this wheelchair would be? Let's see, this is going to be a quiz. The main characteristic is that it has a crossbar that forms an X right here. Does everybody know what type of frame this is? It starts with an R. That's a hint. Oh no, F, sorry, F. Foldable, exactly. This is one of, sorry, yeah, I got confused there a little bit.
He's thinking his language.
Yeah, I'm translating, I'm sorry. So this type of frame is called folding. And the main characteristic is that it has this X right here on the frame that allows itself to be folded. When would you recommend a folding wheelchair to a user? Specifically if they need to transport the wheelchair to different places. Because, ¿cómo se cierra esta, Giselle? Yeah.
So you have lateral folding, lateral, but you have another type of folding. The name is reduce the chair. So in
Collapse.
fixed frames, as Ismark showed us, you can reduce or fold the back post. So it is different, but it is folding too. So you can say, do you want folding? Yeah. How? Lateral or front? So it depends, because for example, here in our territory, it's better to bring it
Yeah.
like this one. If the patient is active, or if the chair will be used by the caregivers. But if you have, for example, a child with moderate independence, not very active, and with requirements on posture, for example, we need anatomical backrest with trunk support, with a cushion, anatomic cushion. Maybe I recommend a folding wheelchair for that child. But if you have a child that it is very active, with a lot of movements, with a lot of functionality, I prefer the rigid frame. Yeah, because it's less, it's lighter than this. Okay, lighter. Yeah, because folding, you have more material, you have more screws, more weight. So if you need to reduce the weight of the chair, please choose the rigid frame. Okay?
Would you say a factor to consider in terms of which folding chair to get would be what vehicle the patient has? So some patients may have a sedan.
Yeah.
So this might fit in the back seat laterally folding, laterally. Where someone may have a SUV or something with a big trunk where the back folding might be easier.
It's easier fixed than fold. Fold, you have to remove more parts, and it's heavier
Yes.
than fixed. So it depends on the diagnostic, the use, and the functionality of the patient. If the patient is very active, please choose the rigid frame. If the patient is not active but want to propose or has some needs to postural regarding, so you can choose the folding, because the parents will take the chair and put it on the van, or
Yeah, they can put it on a car, they can store it
if you
in
have
the house.
Children, you can choose. Children, you can choose rigid or folding. It depends on the parents, because it's heavier folding, but it's easy or it's more compact.
Yeah, compact.
It's more compact to put in a car, smaller car, than the SUV.
Yeah, so what we would recommend is when you're doing the assessments, ask the parents, how are you going to move these chairs around? Some parents don't have transport. Some parents leave the chairs at school. So when the child goes to school, the chair will be there for them. So it just needs to figure out what works for the family and figure out how to adapt it. Don does this often, figure out what options are available, because sometimes the electronic ones, they can't fit in their house or their car. It's too heavy. So we have to think of other options for that.
For example, here, sorry, you have the rigid frame. If you can remove this, see how many parts you have to remove. This, the leg, the hangers. In rigid and in folding, both. Okay? So remove the brackets. I don't have that.
This one's the older one. The newer ones are easier to remove.
Yeah, yes. Here we have both two options, recline and tilt. When you choose both in a chair, you can do this. You couldn't. You cannot do it. It's important to have in your consideration because of that. In iris, if you ask for reclining, manual reclining, and tilt, you couldn't do this. Just remove the wheels.
That system
That's
is
it.
called quick release.
If you just choose the tilt, you can put that back post in front of this. You can fold it. So you have the car. Okay? So if you ask this chair folding, you have to remove one thing more. The seat back. So let the parents know that they will have more parts to remove. And that's in I prefer the rigid frame on tilt. I prefer because it's less maintenance. The folding has more maintenance than the rigid. That system needs more maintenance, right? Right?
More maintenance
And
and
has
more
more
room
movement.
for breaking down as well. But honest,
Yeah.
moving all the time.
And has more movement. Like a little movement that
Yeah,
the
yeah,
patient
that's true.
feels like comfortable. Okay.
Yeah, that's why sometimes when it comes to rigid frames, they try to compensate on this transportability by allowing the backrest to fold down. Instead of collapsing vertically, you can collapse this part of the backrest down and it makes it a little bit smaller, but as you can see on the frame, it's completely rigid. That means that you cannot be able to fold it, but it comes on a user-to-user basis. If the patient and its family wants the transportability, you can offer them when it comes to a flexible frame. If they want something to be more lightweight, they are more athletic, they can use their arms to propel themselves, you can consider the rigid frame to be a better option for these types of users.
Compared.
If I may add something on this
Yes.
one.
See it. More material. Heavier than this one. So when you have a patient who is very active, you consider he wants independence. So if you put that, maybe he will ask, "Oh, help me, please." Heavier too.
Yeah.
So with this, the patient can do it by himself.
I can say something on this. Can I say something on this?
Yes.
We have a patient who he cannot use his legs, but he could drive. So he has his car modified to work with his hands. All right. So what he will do, he will use a chair similar to this one, jump across into his driver's seat, and then remove the wheels, hold this down, and he by himself takes it up and puts it on the front seat next to him. And that's one of the benefits of this style of wheelchair.
You just press the button and the wheel comes out.
So take the chair and put it. But sometimes we have a different models of wheelchairs, of course. Sometimes patients said, a very active patient said, no, I want folding. Folding and folding and folding. So it's okay, it's valid. So we have another option with another aluminum alloy that is
7,000.
and you can have that cross with less weight. So it's the QS 5X in the future available on Laquis. QS 5X, and you can configure that chair with this hanger fix, so it's lighter than the normal folding.
So yes, always try to have this.
Explain how Sunrise manipulate the material, how they la forma,
La forma.
design of the tube.
Ay, ¿cómo era? No me acuerdo.
So
sí.
Sunrise designed the tube different. This is a low medical width. Yes.
Sí.
Yeah. But Sunrise design or has its own design of the frame in aluminum 700. 7,000.
7,000.
7,000. So they said, take this. You take this. And now, please stand up. So please hold that table and show them. Hold it.
You can try it too.
You can try it, right? So now, put it here. Hold it. Hold it. No, hold it. The same movement. This one. Do the same movement.
But now on this side.
Here, inside. Oh, same movement. No, here. Yeah, you. Thank you, sir. The same movement. Okay? Now, hold. It's
Impossible, right?
It's impossible. You can hold this here. It's the same movement. Straight down. So now, in this position, I try to do it and see it. It's impossible. Right? So they designed the tube oval, thinking on that. Because the warranty is very weak, is the best. So they said, okay, we can reduce the diameter of the tube doing this design. So I have less material, less weight, the same durability. Here, the mechanism is different. They put the aluminum, the tube, in a hip, in la máxima height.
Sí, the max height.
No, pero tienes que decir,
Altura.
ellos lo que hacen es, I explain Spanish, but
Yeah.
explain better than me. Ponen el tubo en máximo temperatura, lo moldean en primera temperatura 3 veces.
Oh yeah, so in order to achieve this type of shape in the tube and the frame of the wheelchair, what they do is that they heat it up at the max temperature that the material is going to withstand, and then they mold it. They let it cool down, and then they heat it again, remold it a little bit more perfectly, and then they heat it a third time to make sure the shape is going to withstand. It's going to have a higher rigidity because it has been molded under high temperatures for 3 times. It's going to keep its shape, and it's going to be a very strong and durable material because of this. So as Giselle and I was mentioned, you can consider ultra light wheelchairs that can be both folding and rigid. So make sure you have this conversation with both the user and its family, its caretaker. Are they going to want a folding wheelchair, or are you going to recommend a folding wheelchair? Always make sure you take into consideration what the user wants. You can try to recommend something that you may want as an OT that you may consider to be a better option, but always take in consideration the user, because the user is the one that has to be comfortable. It's going to be the one that's going to be using the wheelchair. It's going to move around in it. It has to take it somewhere. You consider a folding wheelchair. Are they going to be more active? They have a higher mobility. You can consider a rigid wheelchair. So always make sure to have a dialogue with the user, its family, and determine from that point forward what type of material and what type of structure of the frame you can recommend to the user.
Yeah. We are combining 2 topics here. One is the theory, and the other one is working on the product. So we can moving forward with the agenda. But for example, here, the other difference between folding and rigid frame is this one. When you have folding frame, you have more mobile parts. So think when you are driving a car on the market, that car, shopping cart, yeah, and when the wheels is like that, so you are doing like all your effort is doing that shopping cart would be straight, moving straight, yeah, more than and put the things there and move, right? It's the same with the wheelchair. Every mobile part absorb our strength in another thing, that it is not the translation or the proportion. So think on that. If the patient is very active, you don't want that patient absorb the movement in moving parts. So for example, here in children, most of the time the mother said, no, folding, folding, folding. They are familiar with that. And it is okay. So in this case, Sunrise made this with this system. See it. When you unfold the chair, you can do that. Correct?
The click.
The click. And that rigidize the chair. So we avoid that mobility or mobile parts. Yeah? If you want to move that chair, you can try it. You try to move it, see it. It's fixed. It's the idea, it's the proposed that we want. Focus on propose the chair. Use your strength to propose the chair. So in that patient that you have, the mother wants holding, this is a good option. Holding, but the benefit of the rigid frame could be great for that patient. Use that.
Yeah, so when it comes to recommending whether you want the user to have a rigid frame or, well, the tilt and space wheelchairs, like the one we have over here. When it comes to the tilt and space wheelchairs, they have the ability to maintain the same hip angle when you do the tilt. So as you can see, the angle of the hip is not changing. But if I want to change that angle, I can do the recline.
So 2 models. What I choose. I choose. Other model, you. It could be you, yeah. No, next you. Yeah. Woo. Ana Maria. Ana Maria is you will tilt that chair. Okay? You easy, don't worry. Okay, tilt the chair. What do you feel? Fair? Yes. Okay, again. Oh. What do you feel? I feel here. Here, what do you feel? See it. So, thank you. So, what happens here? When you use pistons,
Yes, pistons.
when you use pistons, you suffer that. You experience that. Because you move your center of gravity and the center of the gravity of the chair, right? Move. So I feel like, oh my God, I felt, right? I am in danger. You feel that. And the patient feels that too. So in cases when you have patients with a lot of spasticity, and with a lot of effects. Yeah. So avoid that kind of thing because of that. But if you have this one, that it is with rails or reels.
Rails.
Rails.
Yes, now rails.
So you have rails, you have the center of gravity of the patient, same as the center of gravity of the chair. Good point. So in those cases, you avoid that sensation. Yeah? Because never change. It never changed. Now, imagine. Here, where is our center of gravity? Where? Here, where? Where? When we are sitting? Where? On the car? Yeah. On the pelvis? A combination. It's here. When we are sitting, it's here between this part. Here is our center of gravity.
There you go.
So the idea of this chair, that it is iris, intelligent rotation in space, rotation.
Awesome.
So imagine a circle. That chair was made. Imagine a circle. You have a circle here. You cut the circle. In a circle, you just have one center, right? 1 point. Center of gravity, 1. So the idea is to align the center of gravity of this chair to the patient, so the patient doesn't suffer that, right? Because it's more stable. So now, return, model, please. Come back, please. You will try this. Ta-ta-ta-tan. Ta-ta-ta-tan. You start. Take a sip. Go ahead. Don't worry. Do it. What do you feel? You feel the same or different? Safe, right?
Safe. You don't feel like you're
You
fouling.
don't feel like, oh my god,
You can relax.
So, when you use rails, you have more grades of tilt. You could reach 60 degrees. With manual tilt with piston, just 45. 30, 35, 40, 45. 45 is the most grades. So, looks good, right? Feel comfortable? Safe? So now, you imagine, see that base, see the base of the chair. Small. When you have tilt with pistons, you have more base. Because of that, because you change the center of gravity, so you need the stability to prevent or to avoid the fall, right? So in this case, you don't need it because the center of gravity is always there. The center of gravity of the patient. And now I said, but she can fall. I don't know, maybe. No. You don't. Yes, thank you. So now, if I put here force, I have this movement because they're reclining system. I have this movement because reclining system. But in another way, if I don't have the reclining, maybe I try to fold the chair. So see it. If you want to do it, try it. It's very stable. The base is small, it's short, but it is very stable. Look at it. Shake it. Yeah, it's very stable. So you don't need a big base. So it's better for parents who needs to put that chair on the back. Because it's shorter. Thank you. Yay! Very, very. Trust me. So you have these types of tilt.
This has a
Piston is if you see here on the back, and if I raise it a little bit, you can see here is the piston in comparison to this one that has the tilt on a rail.
Two pistons here. One is for tilt, another is for tilt. One is for tilt,
Another for recline. So you can see this one piston is going to allow the the tilt of the chair, and then the other piston is going to allow the recline of the chair. This is going to be the recline, and I can do the tilt, or I can do both. No problem.
Because of that change of the
Center of gravity.
but it is very safe too, and it is more expensive. So it depends on the patient. And if you have patient that needs just 45 degrees, okay, okay. You don't have a lot of deformities. You don't have a lot of specificity. You have for example, a hypotonic patient that just you benefit from the tilt, and you can use.
¿Qué pasa?
But if you have a lot of
No, falta eso.
a lot of
Bueno, hay tiempo.
or
Sí, o sea, aquí vamos a decir todo, de que ir turnándonos hablando de los productos.
thinking more adjustable. But remember this, you are here, like, ay, painting on your tuberosity, right? So you move one leg, change the
The buttocks.
change it, and release the pain, right? So it's the same with the degrees. 5 degrees, 3 degrees, 1 degree, change. It's the same. If you change the degree, the pressure is another point. And release the pain. And warranty more time on the chair. More time in a good position. Because in a bed, it's not a good position. It's free. Free, right? In a sofa, it's free. So the best place is a wheelchair if I am concerned about the posture, about the functionality of the organs. So if you have the possibility to do more tilt degrees, better than the patient because we have more stability, more
Changes of position. Yeah.
okay, so that is the difference. But both are good. Depends on the diagnostic, depends on the patient mix.
So in this graphic, you can clearly see that when you do this tilt in space, most of the pressure that will be on a normal wheelchair that it's at 90 degrees is going to be here on the buttocks. So when you do that tilt in space, you're going to be relieving that pressure from the buttocks and transferring also a little bit to the back so that the user over time is going to feel way more comfortable. And also, as Giselle mentioned, the center of gravity is going to change. We have the tilt in space that has rails that allows the center of gravity to stay the same when there's the tilt in space. Or you have also the moment with the version with the pistons that is going to move the center of gravity, but it's going to be relieving the pressure. So there, you can see the center of gravity is going to be changing, but the pressure is going to be relieving. So as she mentioned, usually this wheelchair is going to be a little bit more expensive because of that functionality on the rails comparison to a tilt in space wheelchair that has this type of functionality using pistons. I think there's a video here that we can play. Uh-oh, let's see if we can connect. Well, we can look at it later. Apparently there's no internet. So we're going to talk a little bit more specific about products. I don't know if you guys want to take a 5-minute break if you want, or do you want to continue?
Yeah, we are tired, right? You are.
All right, we can take a 5-minute break so you can grab water, go to the bathroom, and then we're going to talk more specific about the products that we're currently offering.
What do you get? Huh?
What comes with it?
Ajá, que viene con el broski.
I keep hearing about it.
Just the drink. Not the throughout system. For example,
Quiero agua.
No, tú no has parado de hablar.
Sí. Bueno, Giselle también habló un montón ahorita.
No, pero si era tan largo, lo hubiéramos dividido también.
Ahorita nos vamos a dividir los productos, de que cada quien hable del producto y así. Porque mira,
I don't think
Estamos pensando que haya sí.
It doesn't matter. I think so. It doesn't care. Once you have the 860, it's over. That's fine. Yeah, sure.
Okay, so any questions you may have?
She's downstairs, but she's coming back at 3. Oh, well, patient assessment.
Okay, but I have to leave for a passport because I have to do this.
You can't come back. We're doing 2 patient assessments at 3.
It's gonna be very valuable.
I'm
Yeah,
sure.
she got really interesting cases.
I'm sure she did. I don't know. I was
Just try to put back
because
if you can.
I have.
Oh. If you could try to come back.
Tomorrow will be similar.
Yes. So the only thing is tomorrow we will have patient assessments. So that's so you can split it up tomorrow. If you like.
But I have plans. Okay, I'll see.
Okay.
Gracias. Hasta luego.
Casey, I don't know if you can like go out to because we need to do the
Yeah, definitely I will have to visit.
Yeah.
Better.
Yeah, let's get it better for you again. On the line. Yeah, do I need to switch it? I think a few, if it's turned off, then you can
I think we cannot, we don't show the video now, we just go straight. De que el stroller. Perfect. So thank you so much. Welcome back. We're going to show the video that we couldn't load about the rotation of the Iris wheelchair. So I'm going to show that now. And after that, we're going to look over a very diverse catalog of products, not only of wheelchairs, but also rehabilitation products that may be interesting and that can be recommended to users depending on their needs. So let me show the video.
Rotation and space features never seen in a tilt wheelchair, offering unprecedented benefits. Its intelligence comes from the ability to adapt to changes in the individual and their needs. But first, let's discuss how rotation in space is different from tilt. As the name suggests, a rotation in space seating system simply rotates around a point in space versus tilting from a point on the chair. By doing this, a rotation in space chair has several key benefits. When properly set, the angle of the seat frame can be changed with the mere force of 2 fingers. Because the rider does not move horizontally during rotation, the wheelbase is significantly shorter than a traditional tilt wheelchair. This provides optimal weight distribution and superior maneuverability, even with seat angles as great as 60 degrees. And optimal weight distribution translates to greater chair stability. To fully realize these benefits, a rotation in space wheelchair must be properly configured so the chair's center of gravity aligns with the center of rotation. By answering 4 simple questions on the order form, the Quickie Iris is optimized from the factory. However, things change. Seating systems are replaced, backpacks are added, vent trays are added, seating angles are adjusted, riders' bodies change. Anytime the chair or even the rider changes, the center of gravity can shift, which can reduce the rotation in space benefits. This video will help you assess these changes and make adjustments to maximize the important benefits of rotation in space. The center of gravity is the system's center of weight, and the center of rotation is the point around which the seat frame rotates. Here's how you determine if the center of gravity is aligned with the center of rotation. When the center of gravity is aligned with the center of rotation, rotating or tilting the seat frame is effortless. When the center of gravity is in front of the center of rotation, there is an upward force on the push handle during rotation. When the center of gravity is behind the center of rotation, there will be a downward force during rotation. To ensure effortless rotation, 3 key areas of adjustment should be considered in order. 1. The center of rotation to center of gravity adjustment. 2. The rocker adjustment. 3. The rear wheel adjustment. If the center of gravity and center of rotation are misaligned, start by moving the seat frame and footrest supports to a location that aligns the individual center of gravity with the seat frame's center of rotation. It is also important to re-establish the seat depth by adjusting the backrest. Next, is the rocker adjustment. After the seat frame is adjusted, the overall seating position might be too far forward or too far rearward, depending on the direction the center of gravity was moved. If it is too far forward, the increased weight over the front casters will make the chair more difficult to maneuver. This position can also make the chair more front tippy when traveling over obstacles. If the seat frame is too far rearward, the chair can become tippy when traveling up inclines. This position can also cause caster wheel-to-frame interference. Both positions can be adjusted by moving the entire rocker relative to the base frame to optimize maneuverability, stability, and front caster clearance. The final adjustment area is the rear wheel location. To increase stability, the rear wheels can be adjusted rearward. However, this should only be moved as much as necessary, as this may decrease maneuverability. In summary, the main benefit of the Quickie Iris is the incorporation of rotation in space technology, but its real intelligence is the ability to adjust its configuration to changing needs. To understand these adjustments in more detail, please contact tech support or your local account manager. The Quickie Iris.
I
Support
You need that video?
Tech support, Laquis, Mark.
So as you can see from the video, the center of gravity is going to be really important when taking into consideration how comfortable the user will be when doing this tilting and reclining movements. Because if the center of gravity is offset, then not only the user is going to be uncomfortable when there is a recline or there is a tilt, but also the caretaker or the family member is going to have to do way more force to do this types of rotation. So most of these wheelchairs are going to allow these types of adjustments on the center of gravity that will make everything more comfortable, not only for the user, but also for the family member, the caretakers, etc. So now we're going to continue doing a little bit of a demonstration and overview of different rehabilitation and wheelchair products that currently Laquis is offering in collaboration with LOH Medical. So you want to start, Daniela?
Okay, first talk about the Coyote A. This chair is from our own brand, One Law. Okay, it's an ultra light wheelchair. It's for users that have all control of the trunk. Okay, and ¿cómo se dice eso? They can move themselves. Okay, so it have auto propulsed. That was the word. Okay, it have a caster of 5 inches, like solid. Okay, and the wheels are 24 inches, right? Okay, normally it comes like this way without the cushion. So if you want a cushion, we can use a One Law cushion.
If anybody can't see, you're welcome to stand and come around. Yeah.
Oh, come.
Move.
Come here.
not right.
Feel free to
Hard.
The only thing is when we need it next, we'll just need to move.
And you can touch it and move it and grab it. Okay, so you can verify that it's super ultra light.
I think it is important to let you know that One Law is our brand, our own brand. So it is designed for Latin America. It's cheaper than other lines of products, other brands, and it's designed about our necessities, our needs. Yeah? So in this chair, for example, is an option, an economic option for an active user. Why? Because all that you can see here is included. Included like before. So ultralight wheels. Ultralight wheels. Yeah? With aluminum handrails. Okay? Side guards with fender. That side guards has this. You have adjustability, height adjustability, and depth adjustability. Here, I don't know if you can see, but here you have adjustability. Why? Because if you move the center of gravity, you have to move this, right? To give you that time. So you have that. You have compact wheels, which is different than scissor wheels. What is the difference between compact wheels and scissor wheels? you know scissor wheel? Scissor wheels is like a cross here. So the patient has to be here and push the brakes, the arm. So, but here, you don't need to go down of the chair. Why it is important? For example, imagine patient or any user that has poor joint control, and you have to be like, wow. So you will see the patient doing like this, right? So it's complicated when you have that condition. In this case, you don't need that. Another thing you have is the foot plate.
Foot plate. I so sorry. Okay. You have adjustability in depth adjustability, and angle. Why? If you have clonus, right? If you have clonus, you put the foot plate in a good angle and you avoid that, right? So for example, you need more angle on hangers. You could remove that knobs and moving it forward, and you have more angle or less angle. Depends. The other thing is you have that. So if you have a patient who needs to remove the foot plate to do a transfer, or using prosthetics things, orthesis, so they can remove it and then just put it. Other thing is casters are 5 inches, but by 1.5 inch, so it's wide, and it's aluminum, not plastic. It's aluminum, black aluminum, so it looks like plastic, but it's aluminum, so more resistance. What other thing? You have reclining system, manual recline. Why manual? Because I can change it just manually, not with the screws. So here I have this angle with patient that needs that support, or for example, if the patient needs to do a catheterism, is that the word? Catheterism? Catheterism? Catheterizing. So could put it this like this, see it, and do it. It's very easy. What other thing you can? Yeah, and you can fold it. The other is that you have the adjustability of the front seat height and rear seat height. What it is important? Because, for example, if you are sitting in a common chair with 90 degrees, you have the gravity, the force of gravity here, right? So you are like this. But if you use that force of gravity in your advance, you put higher front seat height and less rear seat height, and you have fixed tilt. And it is very important. Fixed tilt help me to be more comfortable, gain the center of the gravity of the space, or gravity. Okay.
You could adjust it to have a fixed tilt.
Yeah, here. You can adjust it here on the wheel.
Okay, right.
Yeah, and you have here the adjustability of the rear seat height.
Okay.
See it, a lot of adjustability. It is very important. Depends on the patient needs, but
Also, can you add back certain
yeah, you can remove that and you put an atomic backrest and any cushion that you want. And I think that's it. A lot of things, right? And a good price.
Yeah, very good price.
Okay, so another product from One Law is our cushion. Sometimes we don't need, or we don't have a lot of risk of pressure sore, so we need comfort. We need a little bit posture, but not much. So we have this cushion. It is very expensive too. It is thinking to be more transportable here, and you have an atomic way. anatomic design. So you can align the femur, you can align or giving stability on the pelvis, and you have that comfort. So you don't have rigid foam, you have a flexible foam. So it's softer. You have here holes for that breathe, yeah. And with the cover, you have here that breathing. Hey, we are flying. And you have here leather, because it's common when you put the armrest or the side guards, that friction. So it is very important because you can have more long-term life with this. And that's it. The other product is Coyote T Plus.
So in our line of products, usually the wheelchairs are going to be called Coyote and then a letter. In this case, this will be Coyote A because of what material? Aluminum, and also A for active.
Sorry.
Yeah.
Sorry.
Let me adjust it real quick. There you go. So this will be our, let's go. This is called the Coyote T Plus. What would you say the T stands for in this case? Tilt, exactly. Tilt, and then plus, because it has tilt, and it also has... Por leer el orden. Oh, no, ya empecé, sí. So it's Coyote T for tilt, and then the plus because it has tilt and recline. This wheelchair is very complete. When you order it, it does not come with a cushion or a backrest. So you can order the one log cushion that Giselle just mentioned, or you can add a more specific cushion depending on the user. In this case, this is a JGS cushion and it fits perfectly. Also, the backrest, you can have a anatomical backrest if you need, or if you want the nylon backrest. If you see here on the back of the wheelchair, the back post can be adjusted to whatever back you kind of need. They just clip on forward. So it's very versatile. However, this Coyote T Plus wheelchair does come with the headrest included. So you don't have to spend extra money on a headrest. They usually can cost up to $500, $600 on a headrest, right? US. Yes, US.
I think we need to understand it's a lot cheap.
Yeah, this headrest can be adjusted on its angle, as you can see, and you don't need tools to adjust it. It has a little screw right here that you can manually adjust, and as you can see, now it doesn't move. Let's say you want it at a more 90-degree angle, straighten it out. No tools needed. I just unscrew it, adjust it. Yeah, you no longer need to call Mark or ask for Mark to come to do adjustments. You can do it manually at home. Also, you can adjust the height of the headrest with the same system of screws.
Could this be adjusted as well?
The laterals of the headrest cannot be adjusted because, as you can see, this is plastic. So that cannot be adjusted. You can only adjust the angle of the headrest and its height.
Can you purchase with my headrest and attach it to you can replace it. Okay.
Yeah, if you see over here, here is the screw that you can use to completely remove the headrest. You take out this screw, you take out this one, and you can take out the headrest, and you can adapt a higher end headrest if you need, or a more specific headrest with no problem.
Same dimensions with Maya? Same dimensions here?
I don't think they're the same dimension as the Whitmire, no.
You will put the Whitmire?
Yeah.
Here, on the back.
On the back.
Oh, bolted
Yeah.
on this.
You remove this,
Okay.
this, and just put
So
the
there
headrest
are
on
the holes inside here.
Yeah.
This wheelchair, as I was saying, has a lot of manual adjustability that you're not going to need tools to change. For example, thinking about the caretaker, if they want this part of the brakes to be adjusted, to be a little bit more higher up, you just pull on these tabs, and you bring it up. You want to adjust the brakes if they want to be a little bit at a higher angle, you just unscrew over here. You can raise the brakes and screw it, so it's very easy to adjust depending on the caretaker's needs. With one lever, you can do the tilt function of the wheelchair that goes to how many angles? 45 angles in total. And with the other handle, you adjust the reclination of the wheelchair. It is very important to note that when you have tilt in space wheelchairs, you need to have anti-tip wheels so that when the patient is doing this tilt, it won't fall down. You're changing the center of gravity. So if you want also to move the anti-tips, just press a button over here. You can move them with no problem. Also, the single post.
Remember the exercise I did. If you recline the backrest, you have to elevate legs. So you have here possibility to adjust the angle in those cases.
Also, if you want to completely remove the leg rest, you just pull it up, move it to the side, and pull it up again. Just pull it up like this, move it to the side, pull it up again, and I completely remove the leg rest. And they are also angle adjustable using this screw right here. Just put them back on like this. See, there you go. Snap it in place. Maybe need to lift it up a little bit. See, it's like it got kind of stuck. There you go. So it's very easy to take them off if you need them for placing in a car. And they go back on like this. I turn this screw and I can adjust the angle of the leg rest. Also, it comes with single post armrest that can be angle adjustable by just pulling this little knob right here. Height adjustable, I'm sorry. And if I unscrew this part of the arm post and adjust it to another type of screw of another height, then I can just put it like this. It's completely height adjustable.
That chair includes the transit option. It's included. The transit option, you know what it is?
No.
Transit option. Transit system is this one. See this clamps here. See it?
Oh, right.
It's designed for transport. Yeah. For example, adapted buses. Yeah. With the belts.
Yeah.
So you could be with the patient on the chair and moving on the bus.
Do you use that a lot here, like the transfer?
It's used what? I didn't
The transfer.
Clamps.
It's like a bus.
Adapt
For the bus, exactly.
It's not common here.
No, you.
Some buses come adapted for differentiable patients, so they will have that strap. But so people who have vans as well, they could usually unstrap it.
Yeah, the transit system.
These cables, are they supposed to be here or here?
No, they're supposed to be here.
Just like this is correct.
Yeah, and I'll show why.
And these are brakes.
The other
This is for
thing
this
that I think it is
Yeah,
very
for
useful that
this wheel and the other wheel.
This is for this
For the
wheel or that wheel?
this is for each wheel. This is for the left side. This is for the right side.
This hip support.
Oh, because of the cables, yeah. They
Hip support, you can adjust
this one
it in width.
it goes for this
In
wheel,
depth
so you need to swap it
and in
around.
angle.
Yeah.
So when you have width,
This is how it came.
Yeah.
Oh,
you can
gotta ask somebody in this because of that.
But this is supposed to be for here.
Yeah.
advance of that.
So you will need to unscrew it and
putting
then just
this
flip it
in
around.
different angles. So actually, you don't have this in another kind of.
Also, the caster wheels have the quick release system. So I press the button here. I can take them out. I can clean them very easily. I can replace them if they get damaged. And I just snap them back in place.
Yeah, sunrise.
There you go. So the quick release casters are very accessible in case they need maintenance and also cleaning and changing, etc. Also, this wheelchair, here in the piston mechanism that allows it to tilt and recline, I can pull on a bolt right here, and I can take off the piston. Depending on the backrest, I can fold it almost completely parallel to the cushion.
That is the reduced frame.
Yeah, so the frame, I just take off the bolt that is covering the piston, and I can bring the entire upper section of the wheelchair down, and it's going to be way more easier to store and transport.
The headrest, the backrest.
Yeah, if I need to remove the headrest, I just unscrew right here, and I can take it completely off. So the Coyote T Plus allows me to take the different parts, for example, the headrest, the caster wheels, I can fold it down, I can take off the arm post, and the frame is gonna get very small in size. It's gonna be very easy to transport and to basically unscrew and repair, do maintenance to all of the parts because they're interchangeable.
So would you say the main difference between this and the Zippy Iris is fun? Growth with the heat. So that's the main difference.
Bring it down a little. So it's very easy to bring it back. I just gonna need someone to help me hold the back in place. I adjust the piston, and then I just put the lock inside. And now the wheelchair is ready to use again. Also, something very important to note with the Coyote T Plus is that on its, there you go. On the area for the cushion, it can adjust by the length, right? So the depth, yeah. The depth can be adjusted by just unscrewing some of the screws here. So if I prescribe this wheelchair for a user that's, for example, 6 years old, and over time his depth is going to change, I don't need to buy another wheelchair. I can just unscrew this part here, I can adjust the depth and maybe just get another cushion. So it allows you to have a wheelchair that is going to last over time, and it has a really excellent price. It comes with the headrest. You just need to get the cushion and the backrest. Oh yeah, the lateral supports. If you notice here, the wheelchair already comes with lateral supports that can be adjusted by simply unscrewing with an Allen key, and I can adjust them to bring them forward. So you can reduce the width of the wheelchair by a total of 4 inches. So each lateral can move, 2 inches by each side, which allows you to reduce the depth by a total of 4 inches. And for example, if the patient needs more lateral support on one side, you can adjust one side and leave the other one as it is. So it gives this type of flexibility. Any questions on the Coyote T Plus?
So this is the correct bracket for him. I didn't know if it fit properly. But this is a tube. It usually fits on a tube.
Yeah.
I see this is a square.
We asked the manufacturer to. Eso lo había pedido Mane, ¿no? Para lo.
Yeah, you have the clamps. The size
Is this the correct spec?
it's okay, but we design another clamps.
Okay, and look, come here from this one.
Yeah.
You see here? It's bent. It's not square. You see? You see? Yeah? Is that okay? Like that? See?
Yeah, this was one of the issues we determined with the original run. So if you need the other set of clamps that we are manufacturing, we can send them, no problem. That are going to fit the square back post.
So is it safe to use this, or should we replace
No,
this?
it's completely safe. But we should talk about it and then get you the square post.
So Christy, you'll talk about it?
Yeah, I'll tell her after. Yo tampoco. Pero es un walker. Sí. Es un entrenador de marcha. Yeah. If you, yeah, let me bring it back so you can see on the camera. Yeah, repeating the question, she asked if there are any adjustments for taking into consideration for the caregiver. For the Coyote T Plus, there is. If they want to adjust the angle of the brakes, there is a little tab over here that they can pull inward. And they can adjust, for example, the angle of the handbrakes. Also, if they want the arm post to be higher or lower, they can just unscrew this part. The wrong way. So I just unscrew it. It's a little bit tight, but they can adjust the height or remove it completely for storage. So yes, answering your question, it does allow for the caregiver to have a different height or a different type of preference for the handbrake. So yes. Yeah. The angle of the brakes.
I have a question online. If not, what do you recommend for small children with complex customized seating needs besides the QCTs S? I think they mean besides this.
¿Qué recomendarían? Can you repeat the question?
If not, what do you recommend for small children with complex customized seating? Oh, I missed her first question. I'm not seeing it, so you would have to repeat.
Yeah, let's wait then for the other question. So I think we've seen a lot of wheelchairs today. Maybe it's good to talk about a different type of product when it comes to rehabilitation. This product is called the Clip Walker, and it's a product that is used for rehabilitation and allowing users to train their walking. As you can see, it is very lightweight. It is an aluminum frame, and it comes included with a little knee rest. So if they need support just to walk with one knee, they can do it like this. Also, something very important about this product is that it doesn't roll back. So you're basically training the user to go forward and it doesn't go back. So yeah, it will never go backwards. So they're always, yeah. So it's for training, you'll say the march. Para entrenar la marcha, for training walking, it will never go back because you need to allow the user to train their muscles to go forward. So as you can see, it won't go back. ¿Algo más que quieras agregar aquí, Giselle? Yeah, you can also use it for posterior or superior walking. ¿Sabes cómo se cambia?
You can use it anterior. I don't want to, right? You have what? When I recommend anterior and not posterior. When? What is the characteristic of the patient? Flexible? It's flexible or extension?
This is the question.
When? I recommend anterior when I have that tension pattern. Why? Because I need to stimulate that muscle, that part. So if I do this, the patient, right? So I recommend anterior on that. Okay. And now posterior. When I have a flex pattern. Why? Because trying to move the walker. you have to do this like this. Tap, right? You stimulate. That is it. But you can use it.
What's the difference between this and a rollator?
Again?
The difference of this and a rollator, a traditional rollator.
The difference.
Yes.
The stability.
The stability.
This is more stable. You have growth here, more control than the rollator. Rollator is like a transport wheelchair too. It's more transport.
Okay.
Not it's thinking of walk a long distance with a more complicated situation. Okay. But for example, here this is the standard. But this one, it's a trainer. It's a gait trainer. This is not a gait trainer. So support. That is a gait trainer. That is the
¿Quieres hablar de este tú? Los. This one is called the Rifton Pacer Gait Trainer. It's a little bit of a more complex device because it has a lot of different parts that are movable. If you see, the entire frame is black, but if you see parts that are white, that means that they are adjustable.
no tools needed.
Yeah, no tools needed. We don't like tools. We are getting Mark we're leaving Mark without a job. So you can adjust the height very easily by just pulling on this lever. You can adjust the height. Also, this hip belt can be, well, it's currently tight, but you can open it and adjust it depending on the hip of the user. It comes with this pelvic support that can also be adjusted by just pulling the levers. So if you want to bring it backwards, pull the lever and bring it backwards, or you can bring it forward. Also, you can adjust its height without a problem. And if I just pull it and leave it, it's going to stay here and it's not going to move. So you can see it's going to keep its height without a problem, and it's very easily adjustable. This model in particular comes with the armrest that can be strapped to the user. So you just open it up and it's Velcro, and you can adjust it depending on the width of the arms of the user. There is a model of this Pacer Gait Trainer that comes with an odometer in the wheels. The odometer basically is going to tell you how many kilometers or miles the user has walked using the Pacer Gait Trainer. So if you're a therapist and you want to see how much progress the user is having over a course of time, if it comes with the version with the odometer, you can clearly see how many miles or kilometers the user is walking using this product.
You can choose it or not.
Yes, it's an optional attachment, but it's very recommended because it allows you to see the progress the user is having in a numerical way. So you can determine if they're actually doing progress training their walking. I don't like it.
Different versions of the trainer, correct?
Yeah, you can have different sizes. The sizing for this product is determined from the height of the user standing from the floor to their elbow. If I'm correct, there are 3 different sizes, so it can go from very small children all the way to young adults and adults.
How small of a child?
2 to 4 years old is the lowest age group.
Actually, normally it's for the size, not for the age. So, for example, for the height, exactly.
The height,
for
yes.
age. It could be like a really small kid, but it's like a long one, so you can use like an S, for example, and it's extra small also. Large and extra large is like 4 sizes.
Yeah, for this trainer, when you're trying to determine the size you have to recommend for the user, as I mentioned, try to have the user standing up and measuring its height from the floor to the elbow in this position. Because as you can see, when they're doing the walking, they are having their elbows like this. And you can also change easily the rotation of the armrest if they wanted to have a little bit more inward angle or outward angle.
And you can change also the components. what you want to add or not. For example. What was the name of the dynamic?
Sí.
Dynamic system. ¿Cómo se llama? Este tú lo puedes cambiar por lo personal.
Chest wrap. Sí, listo. Oh, yes. Also, the wheels. I don't know if you guys on the back are going to be able to see this. I'll try to bring it up. Lo levanto y lo enseñas tú. Sí.
So we have this type of wheels. So you have multiple directions or just one? Yeah? Or just remove in front of the wheels in front? So if you don't want it, unlock. And then here you have resistance. If you have a
Sí.
beginning
Del frame.
user, you need this ring, right? But continually, you need to improve that ability, that skill. So you can put resistance to do more force, yeah? To strain the leg, the muscles. Same in the all wheels. And the other thing is that direction. So you can block if you, for example, using that gate trainer as a posterior trainer, you need that because you have to block, right? And or put it in another place.
Sí, eso sí pasa.
And also we have
Yeah.
another the other wheels, right? The interior and exterior wheels.
We have two different bases, one indoor and one outdoor. So the outdoor has the same features that these wheels, but they are bigger. And this.
Also,
And the base is wider.
you have one that does a transfer. Okay, so with the transfer.
Yeah, with this one, with the saddle.
That's the e-pacer.
The EP.
Ah, the
Yeah.
e-pacer. Yeah,
So
it's more,
somebody needs
it's
an
more
option.
lift.
Yeah,
Yes.
It's more a lift.
Yes.
Is there option for something here? Oh, this is it here.
Can the EPA still be used as a feature also, or is it just for
Yeah,
transfer?
there is another exactly.
You can use it as walker, but
¿Cómo se llama el otro agarre?
See, there are hand grips.
Exactly.
There's a version with hand grips, so you can interchange if you want a configuration with hand grips or just the arm rest or both. So that is something you determine during the configuration, and then you add it. Sí. Ahora vamos con sí.
Question.
Yes.
So you were saying that you have an elite for outdoor. Is it that you have to buy a separate unit or
Usually, you have to consider the configuration before you order it, but sometimes they make exceptions and they can just sell you the wheels for the outdoor version. Listo. A ver, déjame mover esto. Sí. Bueno, voy a mover esto. Over here. It's fine.
$5 minutes more.
Then we have these two products for bathrooms and este no me acuerdo cuántos sizes tiene. Okay, let's start with this one. This one is the wave. The wave comes in 3 sizes, right? This is just for the shower, and we can change the bottom part. The base will be like roller or that one. That one doesn't move, right? Okay. Also, we have all the straps for the user, so the user don't have to move for the legs, for the arms, the chest, and also here you can have like a.
Vamos a mover.
Like a sword.
Vamos a moverte un poquito más para acá para que se vea en la cámara. Así. Perfecto.
No sé si hay que decir algo más de esto. ¿Cómo se reclina?
Aquí, mira.
Okay. So it's recliner. Exactly.
It also allows you to recline it, and you can also purchase the other accessory that gives it the calf rest and the leg rest.
You have to order before.
Yeah, you have.
I tried to the other day and I couldn't add it on.
Oh, really?
You can't add it on after. No.
Yeah, actually, it happens to me with one client
happens
as
with one
well.
client
Yeah, that's
too, yeah.
true.
You have to ask with cameras.
Yeah,
At the beginning.
and that's
Yes.
better.
Yes.
Yeah, it's better to have it complete. The fabric, it can be removed very easily in case it needs to be washed. And most of the use case scenarios for the weight chair is, as Daniela said, for showering the user. Also, if they want to go to the pool or to the beach, they can take it no problem. And since it's plastic, you do not have to worry about it corroding, and it's very easy to clean. I can basically take off this fabric, throw in the washer, and yes, this will be the weight chair.
So we have the shower. So it's higher, so the parents, the mom or the caregiver could have here the patient in that height, so it's better for the caregiver. For their
Okay, ready with this one. Right?
Sí.
Okay, and then we have the HTS. This one is more for the bathroom itself, like for pee and poo. And shower, yes, also can be in the shower. And you have all these, it's also plastic, so as Ismar mentioned, that's right?
Yeah, it's plastic and soft foam. So it's very easy to clean because, sometimes in the shower, things can get a little bit messy. So you can basically spray it down. Since it's plastic, it's not going to damage the material, or you can clean it with wipes. Can you guys hear me back there? Yeah, so as I was saying, since this is for the bathroom, you need to make sure that it needs to be easily cleaned. So using plastic and basically a little bit of sponge, it can be cleaned, and using alcohol or just water. And yes.
Okay, and you have all these components like a headrest, these supports, lateral supports, the harness in here, the belt in here, and also you can change. I don't know if you can see how super easy to remove normally. Actually, all lift and products are super easy to maneuver. How you say that?
Maneuver.
Yes. Yes, it's just with buttons. It's super easy. Okay, this part you can change it. You have it. This one is like open, but you can have it closed. I don't know if I can. But whatever. This part you can change it. Okay, if the user prefers to have it open. That easy.
and it is closer. So if you go here, you have water inside. Now it's triple pattern. And easy to clean. Yeah, it's yeah. We don't have water inside of it.
Levántale la altura. Levántale la altura. Sí, del otro lado tiene aquí un pull tab para levantarle la altura. En el pull tab azulito. Ajá, súbelo.
The height adjustability.
Yeah, you adjust the height by just pulling both tabs on this side. So one of the main benefits of this product is that if you have the toilet, the user is already sitting down, and roll the user directly into the toilet, and you don't need to take them out of the chair, sit them in the toilet, hold them down for them to use the bathroom. You adjust the height, bring them over to the toilet, and they can do their needs with no problem. You can attach the basket again once you're done. So in case they have to use the bathroom, and sometimes the user cannot verbally speak or say that they need to use the bathroom, well, the basket can hold whatever they did, right? And you just take it out, throw it out in the trash, you just wash it and put it back again.
We have a lot of users that doesn't ask for the basket, so they just prefer not to have anything in the toilet.
and also for cleaning and everything is really easy.
It also has tilt adjustability. So as you can see, it has most of the functions that a wheelchair will have, but it brings the comfort for the user to use the bathroom. Its name is HTS for Health and Toileting System. So just pull it here and you can adjust the tilt. Here you can adjust the height. Yes. The lifespan, usually you can adjust, for example, if the user grows in size, you can adjust easily the laterals. I think the lifespan, como cuánto tiempo puedo usarlo un niño.
Depends.
Different sizes, small, medium, large, and it's based
No
on
es tan
weight
cómodo.
and height. So if somebody's over 200 pounds, they can't use it.
Yeah, since this is plastic, you cannot overpass the weight.
Over what?
200 pounds.
Yes, it's
Depends
like
on the
for
size.
Kevin.
Yeah, you can't.
And how many sizes? I don't know how many
3.
sizes.
This comes in 3 sizes.
And the measurement, how you take the measurement?
Depends on the patient growth.
No, pero eras del codo, es de estatura.
The complete
The total height.
Total height.
Yeah, for determining the size of the HTS system, you need to take the total height from the floor to the top of the head in comparison to the pacer gait trainer, where you have to take it from the floor to the elbow height. So depending on the system that you want to have to take different measurements. In the catalog that Chrissy prepared, there is a ordering form for the HTS, and you can see the different measurements or the different sizings that you have depending on the total height of the user. Yes, definitely. Since it's plastic and very easy washable, it's going to last a long time. Yeah, this is medium. Yeah, this is the medium size. The large will be, I would say, more for an adult user. And yeah, it's huge. Like I could sit in there with no problem.
Okay, I think I'm going to show you the product.
Let's go eat.
Woo!
1 hour.
1 hour.
In 1 hour. Yeah, we're gonna have a 1 hour lunch break, and then it's gonna get very fun since we're gonna have a more live demonstration.
for the patient trainer, for example, and then
Sorry. Sorry again. Okay. Now, when you have the patient, they are ready to take. Okay. Okay. For the history. Okay. So, identification of anatomic landmarks for measurements. So, what is the principal point? Pelvis, right? Is there? Yeah, pelvis. Then, or pelvis, hip, knees. So, oh my gosh. Ah, no, no fui yo. Okay. Pelvic, woo! Pelvic, hip, knees, ankles, back, shoulders, head. Okay? So all of them we will check. Techniques for consistent and repeatable measurements. Remember, I'm going to give you some guide to take measurements because for me it's very useful because I don't miss anything. For example, first in front, okay, in front of the patient. Take some measurements that I will let you know. And then when you finish that, you take the lateral measurements and then posterior. So if you do this frequently or as a rule, you don't miss anything. Difference between static and dynamic. Remember, let the patient be. How? With movements, with stress, with happiness, with sadness. See the patient. And then try to stabilize, stabilize, stabilize the patient, okay? And then take the measurements. Could you help me, please? Thank you. So prepare for the measurements. You have to be with a rigid surface. Yeah, of course, it's better. Then
So a hospital bed is not a good surface.
oh, this is okay.
No, but this is a massage bed. But can a hospital bed?
Yeah, of course.
That can be done?
Depends
soft.
on the depends on the mattress.
Okay.
But I prefer to put a table, a big table, because if you take measurements in a mattress, soft mattress, maybe you will have a wrong, incorrect measurements. No, take out of the patient, and it is very important. Always, always ask for the patient to bring with the current wheelchair. Good conditions, bad conditions, no matter, but bring with the current wheelchair. It is very important because you can ask him or her, what do you like, what do you dislike, what you prefer, what you could change, what would you change. Okay. Then use a goniometer. Goniometer. Have a rigid measurement tape. I know we have this, but I prefer that one. Please take that one. It's easy for you. It would be easier than this. But now, today, we will practice with this. Then have the measurement chart or the technical specification that you have, and then positioning as possible as you can. Neutral pelvis, neutral trunk, 90 degrees, but as possible as you can, as possible as the patient allowed me. Okay. Next, please. So considerations. That's the 3 priorities. Sensation, skin condition is the first one. Why is the first one? Because it's vital topic, right? So if you have no sensation, you have to consider different things on the pelvis, different surface that will be in contact with the skin. Posture, of course, you have to check the posture, the contractures, the deformities. So you have to check it that. And the last one, and not less important, comfort. Because if you have everything beautiful, aligned and everything, but the patient uncomfortable, never wants that. Other factors, cognitive status is important. For example, a power chair, never. If I don't have cognitive conditions. Psychosocial factors, aesthetics is very important, aesthetics, as in acceptance of disability. Environmental and accessibility consideration, as I mentioned before, where the patient will be using the chair. Now, measurements. We can have, and it is important that you maybe could buy to AA Laquis, is that caliper. The caliper is a good tool to take measurements, and it's easier than the tables and the tape measure. AA Laquis could sell you that thing. So that is the position in front, posterior, and lateral. Okay, in front we will take these ones. We will take by trochanter, with trunk width, shoulder width, width of the legs, and width of the toes. Here, width, and then width here, but I prefer in front, that one, and lateral, trunk height, depth, and leg height too. So then we're gonna start. Do you have the sheet there, right? Do you have the technical chart?
And we're going to divide everyone into 5 groups.
Yes.
So maybe we can start by saying a number from 5. 1.
Yeah, mixed you.
We're going to start with number 1. The person to your
No.
1, 2, 3.
Come on. 1. 1. Sandra, 4. 5. So again, explain it again, please.
So we're gonna number everyone from 1 to 5. And then every number 1 is going to get together. All the number 2s are going to get together. All the number 3 is
Why not?
It's better so you.
Are you OTs and PTs? Why not?
So that everybody can practice with different people and start seeing how to do the questions.
Okay. Make 5 groups as you wanted. 5 groups, okay? Is it okay? Yeah. It's better? Okay.
Everybody, we need 5 groups that are divided, so please get in.
Son 45. ¿Cuánto serían 40 entre 5? No, 8 personas por grupo.
Exacto, 8 personas.
8, dile.
Okay, it has to be like 8 people per group. So maybe you're going to do it together. Yeah. I need more of these. Do you have 2?
Ah, okay.
Do you have 2?
No. I think with 5.
All I have is 5. I think they're doing 8 groups.
No, 5 groups.
5 groups?
8 people in each group. Ready? Y una cinta. Esto y una cinta. Okay. Sí, pero no quieren. Para adultos que a niños, no tanto.
right here.
So just let me know what form.
Pero aquí ocupamos luz.
And I will put it in the QR.
Okay.
Aquí hay otra. Aquí hay otra. Ok, que se dividan, que se levanten y que salgan en grupos ya. Choose one person in per group. Choose one person who will be the patient. Okay? And take one chair to take the measurements. If you have to move the tables, move it. Oh, ay, Dios mío. No, yo la voy a usar.
Oh no, she's gonna use the bed for the
Yeah, I am the model. I am the model. You use the chair. Sorry. Y nosotros tenemos tablas. Para nosotros, ¿no? ¿Verdad? So groups, go, Mama, come on, come on. Group, who is the group number one? Okay, number one here. How many are you? 9. Okay, number one. Group number 2, you. You? Number 2. Okay, group number 2. There. Number 1, who is the patient? Where is the patient on the chair? Okay. Group number 3. You? Okay, the patient are you? Okay. Take the space to take the measurement. Yeah. All together. 3, 4. Group 4. 4. 4. Yeah, who is the patient? Who is the patient? So take the chair and take a space to. Yeah. And group number 5. 5?
That last row. That's group number 3.
No, it's different now.
Okay, 5.
1, 2, 3, 4, and 5.
You're number 5.
Who is the patient?
So what's your name?
Take the space. Great. Take this. Take a chair and take a space to do the measurement. So now, pay attention here, please. Now, the dynamic is this. First, I start with the measurement, and you reply. Okay? You repeat that. But first me. Okay? Yeah. I do it, and then you repeat it. So our patient is Daniela. Okay? I don't have tables, but I have this. Okay. Mi medida, mi metro. Okay. So ready? Okay. First, in front. Okay. We have.
Maybe if you want, you can turn.
Yeah. First one. Ready?
Yes.
Bitrochanteric. We have 2. One is pure bitrochanteric. Is it here? You put the tables here and then push. Okay? Push. You have the reference, the crestus. Crest? Okay? So you have to push, and then when you push, take the measure. But wait. Querido. Estrípale porque yo tengo que meter la medida. So, see, you have to take this like this. Inside, not outside. Inside, and very close to the patient. Nor, not this. This, okay? So, I take this. Tripa, and then take inside, okay? So, she is 13, for example.
And then you have to take bitrochanteric with excess, okay? With fats, with curves, okay? So the same thing, inside, close to the patient, and then take the measurement. That measurement, the combination of one in middle of both. For example, maybe she is not, but we suppose that she is fat, so it's obese. So I have a lot of excess here, but the trunk width is smaller than the pelvis. So in those cases, you have to choose an intermediate measurement, so that measurement helps you to prevent scars and conservative width. Is it clear? So take that one. Question there. One is tight and the other one is considering the excess. Voy a ir a ver, quiero ir a ver todos. So, 2 tables.
Inside, but it's too high.
Where is the other? The other one, this one. It's better because it's rigid. Yeah, push. Actually, you take here and push it back.
Push it back first. Get it back.
First, take touch this, and then consider maybe would be closer of the crest. What is the question? So first one is tight, considering the crest. So the head of the femur. So here, sorry, you have to take this one, considering the crest, and then you have to take that excess. Good patient. Inside of the table. Both are inside. Okay, that one, that is incorrect, because of that I prefer the tape measurement rigid, because of that, because actually it's like this, not with curve. No, not because it is more than she needs. How?
Is this inside?
Inside and close to the pelvis.
Okay. So, and then.
Okay.
Oh.
Yeah.
Good.
Inside, yeah.
You say
And
27?
avoid this. Avoid
Yeah, don't
contour.
bend.
Yeah.
Las dos tiene siempre que apretar.
No. Una es con excesos y la otra es apretado. Yeah.
But putting the plates on the side, the boards on the side.
Putting the boards. Yep. So now, the second, I want to see it.
At the widest part of it, right?
Perfect. Try to avoid flex this. Yeah, rigid, very rigid. Show me, please.
This is the loose one. It's the excess.
Okay.
All right.
Avoid this one, is rigid, okay? So, and this is not correct because we have to consider this one.
Oh.
Exactly.
Yeah. So what?
So if you use that, you have to consider this one.
Yeah. The mic is off. Optimate here.
Hello. Hello. Could you hear me? Could you hear me there? Could you hear me? Yes? Yes or not? Ready?
Ready? Everybody ready? Everything good?
Ready? Next. Next.
You want them to go downstairs and use whatever and apply it. So what
Okay.
so we'll give them like 5-10 minutes.
Okay.
To go downstairs and they'll bring up the products with this and talk.
Okay.
Second one.
Estamos aprendiendo todos.
Yeah. Second one. Ready? Okay.
All right, let's continue, everybody.
¿Cómo le pusieron trunk? Okay. This one, 2, okay, then trunk width, okay, is the same. Remember, the trunk supports always will be on bones, not here. So, ribs, in our ribs, right? There, not behind of there. So, take that, put the tables forward, and then because of that I prefer this one. Because you are doing like this and it is not correct. You need this rigid. So with one hand you can move it. So you put it here and then I have inside and close to the patient. Are you seeing that? Okay. And the other one is, remember, the height is here. Is the ideal. So, right, thank you. Okay, that is the height. Okay, the other one that you will try is the shoulder width. So, take the acromion, yeah, identify it, and then take the width with no tables. It's touching the acromion. Yeah, ready? Practice.
Would your table just be really far out?
Yeah, you can, yeah, but be careful because sometimes,
It will go in.
yeah, exactly. You have to be rigid. Yeah, seeing like this, and be is parallel. Yeah.
So like right now it's coming in.
So, actually, in patients that they are very active, guys, when patients are very active, the height is not here, it's not the boost, it's behind us, yeah, it's here. Because we just need a low support. So, in that cases, take lower than this. This is very active, you don't need that. You need lower than that. So be careful because see the tables. You need to be parallel. Yeah, that one.
Okay, so it was on that.
Chromium. Okay.
Want to see acromion?
You lift the arms for this first one, right?
Yeah.
Of course, yeah, okay.
Yeah, and remember, trunk support, don't be touching the axle. Armpits. Okay, yeah, don't touch the armpits. So you need to lift 1 or 2 inches. It's here. Yeah.
I think wider on your left. Till your zero is
Thank you. 2 fingers or 3 fingers. At least 2. At least. Depends on the condition of the patient. Okay? How? Ready? I want to see it. The shoulder width, profesora. Shoulder width. Oh, avoid this. Remember, yeah. Yeah, good. You have a good case here because she has more width in hips than here. So in those cases, you can choose narrow back breast and with I will share more with more width. Sorry.
What's the reason that you are measuring in front?
Ah, good question. I will.
Because I see that when they're measuring, they are with the.
Yeah, I will explain that. Are you ready?
So even if they're like tilted like this, you're still taking care.
Ah, yeah. Hi. Ready? Explanation. You have a lot of doubts. Okay, ready? Pay attention. We have a lot of doubts here and good questions. One is why this measurement is important. Why? What do you think? Yeah, because the back post. For example, if you have a patient with a big scapula, big back, yeah, good, big back, and a small width here, so you have to consider an intermediate measurement too. The other question was, oh no, another thing that I saw is maybe you could have patients with more width here than here. So in those cases, I recommend you the same thing. Do an intermediate, or in backrest is easier. In backrest is easier than the width, the width of the chair. Why? Because you can choose different width of the back, but considering the same width of the chair. So we offer that. Our products, our backrest offers that. So offer that. Sorry with my grammatics. I have a question. They have a question, yeah?
They want to know if the same with the
J3. Yeah, but you have back post and then the backrest. It's different. Back post and backrest are different, right? Back post is the same as width of the chair, but the back. Good question. Creo que ellos también tenían la misma, ¿no?
Sí, de escoliosis.
Yeah. Let me show you. That one. That one, right? You have a lot of hum, right? Hum. A lot of hum here, hop or hum, hum here, and here another deformity, right? Oh my God, what can I do? Take, where is the table? Take the tables in the convexity here and here. And then you have to take that with, you have to consider that, because if you move the patient, you move all articulations, and then that is the final result, you have to consider that, because it's the better position that the patient will have.
You have to do
So
it like this.
if you have this, you have to take that with, and you have to consider that on your chair. If you don't consider that, and so just consider this, maybe that part will be out of the chair. Okay, so take this one, you have to be more exactly, and take whole width. Okay, is it clear? Okay, it's the same. It's the same with the
It was like diagonal. No, was from here to here.
Not diagonal. No. Here, see it here. I consider that point.
It would be this.
Yeah.
Yeah, it was like a straight. Yeah, it's straight.
Yeah, because the chair will be diagonal. No, right?
Yes.
So let's see it here. I have the pelvis there. and I have the trunk support here. So the idea is to have different height of tables, and you can take the measurement here. Okay? So the same thing with shoulder. It's via trochanterica with excess. Trunk width is the same. But what happened if I have this? In this case, what happened with the trunk supports? What do you think? Could be the same? No. The width is the width of the trunk. We couldn't change it. So you have always take this one. We, AA Laquis, and we, Law Medical, have the responsibility to choose the correct backrest to reach that trunk width. Okay? Maybe with another type of trunk supports, maybe, but we decided, not you. You just provide the measurements, okay?
What we also recommend is when you provide the measurements, you give like a summary sheet of the patient and pictures. Yeah. So they can then see what you are seeing.
Exactly. Because of that, it's so important to take pictures or photos of the patient.
Or videos. Or videos. Yeah. So we don't do quotation without that, because we could do a lot of wrong assessments or a lot of wrong billing.
Yes. And it happens. Yeah. It happens.
Okay, now next. Are you ready? Interesting, right? Okay, so in front, what other measurement maybe we have to consider? Good. Knee width or leg width? Why? Yeah, and most of the times when we consider that is in active patients, because maybe we need more ergonomic wheelchair. So we have to consider that width, because if I ask for a inset 2, that it is very aesthetic, but maybe touch the leg and produce a scar. Exactly. And the last one is the width of the feet. Okay? Why? Because the same thing. When you inset the frame, you reduce the width of the foot plate. So it's important to have that, because sometimes we have patients with a huge foot. Yeah. Okay, so take that. The last in front. The last one in front. So remember, now I have a challenge for you. Taking the same patient, right? Considering the width, how many inset will you ask for them, or here? How many inches? Do you know what is inset? Do you know what is inset? Okay. No, inset. Inset.
What's an inset?
Is that inset?
We can show it.
It's that one. That one. Okay, here. So this is a straight. This is 1 inset, 2 inset. What is that? Is that inset? Is here you have the width of the chair, right? If you don't ask for any inset or inset, it's 0, it's a straight. Okay? This is straight. But if you are considering an active patient being more aesthetic and more ergonomic, you have to reduce some inches. 1 inch per side or 2 inch per side. The name is inset. Okay? Is it clear? More graphic. So do it, because it's a challenge. And this is your patient. Is it clear? Okay. This is the legs. The legs. This one. Yeah. Maybe. Yeah. I prefer that.
I don't think I know the inset point. Tell
You
me
don't
again.
know?
No, I didn't see it.
So
I'm not sure what
let
you
me
mean.
show you. Don't worry. So the inset is that I have, for example, 16 inches width. 16.
Yeah.
And I hope no, I am very active. Okay? So I want my wheelchair very aesthetic, ergonomic. So yeah, exactly. Slim. Okay? So I have 16. Oh my god. I have 16. I choose because I consider the width of the legs and width of the foot that I can have 2 inches per side. So, for example, 16 less 2, 14 less 2, 12. How many inches do you have here? Is it okay or not? That you decide the inset. So if I can put more inset, it would be better because it's more economic, it's more fit, it's more maneuverable.
So what you're saying is, I'm going to take this measurement, and then I'm going to determine how
Here,
much room.
not
yes,
his one,
here,
this one.
your hip, and then I know how much I can come in here more based on probably atrophy of the feet, whatever. Just how
Yeah.
tight the space is.
Exactly.
On that
How
person.
tight I want to this. Because remember, the active patient needs to be more close
Tight.
to the mass of the body.
Yes.
He needs that close to her or his is the mass of the body. It is very important to be more active, more maneuverable, more functional.
And then
If I have my foot there, like, oh my god, a lot of weight there, disturbing my action.
And we could do as much as we want. Or the chairs
Two.
have-
The
it's
maximum is
always
2 per side. Is the maximum. The minimum 0, 1, or 2. The side
Comparison
depends.
to your pelvic.
Yeah. Now the size depends on the measurements of her.
Got it.
You're
Okay.
creating a story for this patient, right? What kind of illness?
Is it clear?
No.
No, don't worry. Let me explain you. So, when you have an active patient, the most important thing is to have the mass of their body closed, okay, of the control. So if you have weight there, maybe would be difficult to control the maneuverability of the chair, right? But if you have close your weight close to the with your mass body, would be better. So in those cases, if you have this straight, maybe suddenly that foot legs like. So it's better to have it close, control. In those cases, I choose 1, depends on this width, 1 or 2. Imagine, suppose I am 16. If I rest 1, 2, 1 inch per side, how many inches we will have here? 14.
Or 16 is your
16, 14. If I reduce 2, 12, right? So 12 is good for me? I don't know. You have to take this measure. This and this.
So this is from
So
patients
we
who
take out 2 from here and then measure here to see if
Exactly. Considering this, you can less 2, 1 or 2 or 0, and depends on your desire too. Because sometimes patients said, "Oh no, I don't like this design. I like straight." So it depends on the patient. But considering the functionality, it's better to have it close.
like athletes, sports.
Yeah, athletes yeah, it's very tight.
that would be 17.
Is it clear?
Comprende.
Excelente. Is it clear? Is it clear? No. Yeah. Okay, both groups. I will explain you this. Both groups. Because I explained that there to them. So, if you are an active patient, do you want to be very tight? because you don't want a weight there that wastes your time, your energy there. So it's difficult to maneuver the wheelchair. 2 inches, it means that you will be 8 very tight. It's not a good option. Maybe we choose 1 inch in this case because you are very thick. See?
Make sure to take it in.
Has sense? Yeah. How many inches do you choose?
We gotta have 1.5 on each side instead of
No, just 0, 1 or 2. 0, 1 or 2.
So can you take 2 off on one side and 1
How
on
many
the other
inches do
side?
you choose?
So she's 19 here. And then when we took away 19 and
When we took away the 2, it got 17, but the 17 is still a lot of room.
yeah.
But when we do 15, 15 is...
Nobody.
Is it all the song? Testing, testing. Testing, testing.
It's their choice at the end of the day. That's the thing. Because who's gonna do the adjustments run after? Who's gonna do these little
Testing,
things?
testing.
So that's I think to me the art here is the most important thing. Because Mark has been doing this for like 8 years, 9 years. He can now adjust.
Excuse me. Hola.
Are you tired, right? Está cansado. What is the result? How many inches did you reduce? How many inches?
4. Oh, putting insert?
How many inches? 2. What is the measurement of the width of the pelvis? 15 and then 13. No, onto the scapula. No, this width? How many?
So for the knees, I think you mentioned crochet.
Here. The measurement takes not on the knees. It's here. 12. Okay. 15 and 12. 15 less 4 inches.
15 less 4 inches is
11. And she is 12. It's not correct.
11.
She needs just 1 inch, not 2 inches. Because of that, that measurement is important. Is it clear? It has sense?
Say that one more time.
You are 16, right? Your chair will be 16. And you are 12.
Okay.
So if you reduce 2 inches, it is 4 less inches, right?
Should be 11.
So 15 less 4, 11, right?
Yeah, you're right.
And you are 12. It's not correct for you. Because maybe the tubes will be here, touching you.
Okay. Okay.
Too tight for you.
Yes. Okay.
Now? Yeah?
So you go from 15.
The last.
No, todavía no.
Now, you. What do you insert? What is your insert? Which insert do you choose?
Insert of the... Oh, I was just measuring the other two things. The insert was the leg.
But it not is the knees. Not the knees. Below, below. No. There.
Measure 3 points. The feet, the... And the
If you want, but most important, that one. Yeah.
Based on that measurement.
Yeah, because knees will be the same width than the width of the by the trochanter.
8 inches.
8. So how many inches has in pelvic? How many? 14. So what inch do you choose? 1, 0, 1, 0, 0, 1, or 2? It's better be closer. 2. Okay. So she's 14, right? 14 less 4? 10. How many inches has? 8. Is it okay?
Because it'll be wide with the 10. It'll still be too big. It'll be big.
No, it's good. 14 plus 4. And she's, how many inches has? 8. Yeah, it's good.
10 is good then.
Yeah, because 14 less 4, 10. And she is 88. Is it okay?
But is it when the white is 9-inch?
Yeah, it's not, yeah. It's not recommended if it is 9 because it's very close to 10.
Okay.
And remember,
So
you have the total width considering the tubes, the width of the tube.
Oh,
So it's ½ inch per side. So it's very tight. It's close to the measurement. You have to choose less.
Or you can do like
Okay, continue.
You can do like quarter.
For example, remember the tube of the frame has like half inch per side. You have this. Bueno, I will explain you to everybody. Pongamos la silla aquí un toquecito para explicar una cosa del ancho. Now, continue, guys. Yes. How many? Just 1, 0, 1, or 2. Where is? I'm no, he's not. No, we have to update this. No, actually, we have to update it. So, vamos aquí. No, es para explicar una cosa. 1, 2, 3. Okay, please pay attention here. Guys. Woohoo! Here, remember, you are taking, where is my type? My tape. Thank you. Now, you have to consider that you have this width. This width is outside. It's the same here. Outside. How many inches I have here? 1. So in case it is very tight to the limit, less 1 inch or 0 because of this. Is it clear? For example, this is 16. Reduce 4, 2 inches per side. So I think 4 is 12, and I am 10, maybe could fix. But if I am 11, maybe not, because I have to consider this space, right? My legs have to be fixed here. Is it has sense? Yeah. Sorry. Guys, here, you have this width. Outside to outside, right? Outside. So here is the same. You have to consider this tube to choose the correct width. So you have to less 1 inch. Yeah? Okay, continue with the rest of the measurements. Now, vamos a dejarlo ahí. Okay, now we finish with the measurements in front of the patient. Check. And now lateral. Okay, lateral. We have to take. So be careful here. When you put the table, put it in the sacrum, not here. Okay? Why? If you put here, it is wrong. It is wrong because we have bones. We have to respect that bones. So you put this one more bigger and then slide it. And then you can take the measure. Considering the sacrum. Okay? Respecting this space. This space is needed. Why? Because I have sacrum. I don't have that curve, right? The chair is straight. So I have to consider the sacrum. And then, put in there, because of this, it is better. Use, oh my God, te quedé sin la chuchita. Oh no. Do you have one, Mark?
Yes, right there.
Ah, great. Thank you. Ah, mal de ojo se llama. How can I say mal de ojo?
There is not a term in English.
Mal de ojo is like you are desire my tape, and
It's like when you
you attract bad vibrations.
energy.
Bad vibes. Okay, I am joking. But it is true. Okay, now. Ahora, Neng, take here, put always big, start here, not here, okay? It's here. This is the base. And then use your finger, the middle finger, and then I have the middle finger, and that is my sign. There is 18. That is the measurement that you put on that sheet, okay? Sheet. You understand me, yeah?
3-finger rule.
But it is for me and for you when receive the product. Not is anatomical. It's not anatomical because if you rest inches, I reduce more. So imagine she is 18 and you put not 18. Put, she would be 16. And I was like, she is 16. Oh, I have to ask 14. Yeah, you take anatomical measurements, not consider product. You consider the product when receive it in the delivery. You check that they and we did it good. Okay. So in those cases, I want to let you know something more related with active patients. This one. Aquí para que me vean ellos también. Ok, se van a tener que poner de pie. Can you move the camera, please? Okay. Here, I don't know how. Here. So, this, you have to see that because it is important. This for me is too long. It's very deep for me. See it? So in my case, because I am tall, I think, here, if I put my leg in 90 degrees, maybe it is okay. But I don't need that. I need this one. So I need to reduce more the length, the depth. But in our considerations here, not you. You put the anatomic measurements. But it is important that you know that because sometimes I ask this depth less than you expected. It's because of that. Because we need this. In pediatric, we choose tight, very close to this, because they are growing, so it has sense. But in adults, it's not. It's not correct. Okay. So here, for example, it's normal for me. If I will be in 90 degrees, it's good. But I am supposing very active people, very active patients, and I need this. So it is very close to me. See it? For the online. For my fans. To my fans. Fan club. Okay. So that one, and the other one in lateral is the length leg. Okay? Important. Take the measurement considering the heel. Okay? The heel, not the toes. Toes. My gosh. Toes. Okay? It's not correct. Why? Because I take these measurements, the height will be here with the foot plate there. So when I want to adjust the foot plate, I will be like, oh my God, never touch, it's too long. Could you see it? Yes. So if you consider the heel, you have here, take me the cuaderno. So here, and you said, oof, it comes like here. So, oh no, it's very short. No, we have to adjust the angle of the foot plate, and then you have the correct height. So always take heel and then the same finger, put in here, and then you have the measurement. With assistance would be great. With the correct assistance, there. 17, okay. And the other one in lateral is armrest height. So because of that, I ask for a flat surface because of this, because I have to do this, that. Okay, she is 10. Why it is important? Sometimes, I don't know if you see that, but some patient pediatrics are like, because of that. So that measurement is very important because of that. Those measurements are in lateral. So practice. Ay, no me pillan este. Qué cochina.
Sí.
Y es que se fue todo. Yeah.
Sí, no, ya no lo puedo sacar.
Ya no lo puedo sacar.
Mira, y ese estaba súper bonito.
Sí.
Es que justo lo había dicho.
Y pues quería. Me lo estaban deseando.
Sí.
Aquí tomaron B, C y K.
Bueno, decía mi abuelita que ahí se fue todo el maldeo.
Ay,
Y
qué
no te
dicha.
cae a ti.
Ah, bueno, entonces eso sí. Ahí sí estoy feliz. Be careful with the rigid. Yeah, rigid. Right. Ya viene el paciente. Tan linda mi chunchita, ya no tengo, ahora tengo que comprar una. No, tiene que decir que me consiga uno.
Yo tenía uno. Está todo mordido.
Take both sizes, right? Because maybe you have lock section. Take both sides, right and left. Or you have maybe, ¿cómo se dice acortamiento?
Kismat. Un acortamiento, pero de cortar.
Acortamiento de una pierna más corta que la otra.
Like,
Of you, honey, shorter than other, but anatomically. Aquí nos inventamos las palabras.
ya, claro. Ay, Dios. Sí, me están gustando.
Y eso que estás de paciente.
But also your foot is further forward.
Tienen que poner eso.
On zero.
Buy rigid tape measurements, please. Or the caliper.
Construction tape measure.
Yeah. Do you have another one for me tomorrow? Or
I have
tomorrow?
it in my office.
Okay, perfect. Thank you.
I'll see. Might have to get it.
Again? Try this on Zoom.
It's important, because of that, it's important use boards. Because you are supposing, do you have a board or table there? It's complicated because you are supposing. Yeah, it's better because you don't have to suppose nothing. It's that. Straight. Yeah. Yeah. How is everything? Good? Sorry. It's okay. Claro, ahora que venga la pacientica tenemos que medir toda esa paciente. Nos faltan las de atrás. Creo que vamos a terminar a las 4. Porque a las 3 llega la paciente. Dice que ya está llegando. Heel, just the heel.
Entonces,
But she said don't go to the toe. You go to hair, but I feel like that place is a standard.
Yeah. But for example, if you take in consideration this position here, and you take this, maybe it's not the correct, as I explained you are now. If you put here the height and the foot plate will be here, when you adjust the angle to reach this point, see it, never touch, never touch. It's not correct because the length is this one, not this. Here, if you are here and you have the platform here, the foot plate here, you can adjust them and the height is the correct.
Do you measure with shoes?
Yes, with the shoes that patients usually use.
Yes, because the shoe will change.
Yeah, if she use heels, you have to consider that. Yo siempre pierdo mi botella de agua.
¿Quieres agua?
O alguien me la, yo la tenía ahí. Pero yo la tenía, alguien se empezó a tomar la mía.
Yo abrí una y no sé cuál. Esa, ¿no? Esa que está aquí.
Ahí está la mía.
no, no falta otra cosa.
El respaldo.
No de las medidas. Hay que entregar los certificados.
Sí, pero hasta el final del paciente.
Un solo paciente.
¿No? ¿Ya? ¿Por qué?
Como 40 minutos.
Eso me marcaba.
Pero si en la mañana fueron 4.
No, caminando.
Ah, caminando.
Sí, estoy caminando.
¿Pero qué pasó? ¿Por qué se quiere ir?
Te dije, tengo mucho sueño, creo que me voy a ir al hotel caminando. Son 40
Ready? Are you ready? Okay. Continue. I have another challenge here. What happened in those cases? Ta-da! What happened here? what happened? We have discrepancy, difference between one leg and other. We have one leg shorter than the other one. In those cases, take the same measurement, the same, because you are taking anatomic measurements, okay? But when you receive the product, if the patient is pediatric, all depth would be tight, okay? So maybe you will receive a cushion with some cut because of that. If you have adult patients, it's not important if the difference between them are less than two or less. Sorry. Is it clear? When you have an adult with more than 2 inches in difference between one leg and another, you have to cut the cushion. But if you have less than 2 inches, you can manage that. How? I ask the depth of the seat according to the shorter leg. And the other leg will be 2-3 fingers free, as we recommend. So it's good. But if you have more than 3 inches of difference, you have to cut the cushion. Why? Or the seat depth. Why? Because you always have to conserve that distance and not more. Yeah, because if you don't consider that, you maybe will have four fingers there, and it is too much. Because we need support on the femur too. Is it clear?
But on this side, you said, when you said take 2 measurements, you mean both left and right.
Both, always you have to take both, always. But in these cases, this is the seat pan, is the red one, and this is the green one is the cushion. Okay, caught in the cushion. But the base, the rigid base, is based on the shorter leg. Yeah. Okay. We have the patient. So the last one. Last one is the last measurements are my patient, my model. I have a new patient. Okay, so the last one is the back. Okay, so remember. Yeah, thank you. Thank you. So remember, here you have to touch the scapulas. So move the leg, the arm, move it to localize the scapulas. And then you can take scapula, an inferior angle of the scapula, median angle, or C3, C7. Okay? So when you choose C7, when you need a lot of support, when you have strong supports, they have poor trunk control, you need that measurement. But if you have a patient very active, you need the inferior angle of the scapula. Always, when you put an anatomic backrest, you never, or we don't recommend to start the backrest from here. Why? Because touch because touch the sacrum and push the pelvis forward. So always leave 2 or 3 inches space there. So remember, sacrum is a red point to score scars. That one. I am crazy now. A lot of information in my head. Okay. So take that and put it in the form. Now, no, always straight. always, because you have rigid structures. You have the backrest maybe could have a curve, but the height is the same. You could put some support there. You can put some support, but the height is the same. Okay, because if you just do this like this, it's different height, and it's not correct. The height is this one. We can put any support there as you want it, but the height is the same. And that's it. Yeah, and we have cases like this example here, when you have the head very lateralized. So consider that, because sometimes when we have this, if we have a fixed deformity on head, we have to put this not in the center of the backward, instead lateral. Okay, and the other one is, please, other more there, there. So when you have, what is that? Anterior tilt, anterior pelvic, exactly, anterior pelvic tilt, but exaggerating, right? When you have this, I recommend you don't take the height from here to here, because you will have a lot of, how can I say, relleno? A lot of feel here. It's not functional. It looks bad. It's not aesthetic. It's not functional. So in this case, I have to leave the pelvis free and start the backrest up as many up as possible. It's good? Good. My translated. Okay? And then I can feel less that part. See it? Better support, more aesthetic, more functional, less feel. No, this is the posture of the patient. Yeah. I have some technical problems.
Can you hear now?
I think it's low battery. Me too. No, I'm joking. Okay, so this is the posture of the patient. It is like this, and I can fix it. So I have to respect that condition. And how can I do that? Leaving that part with not contact and starting here with less feel. So she will be more comfortable on the chair. And I think it's all with the theory. Just remember the center of gravity, we have to adjust. Remember, always take the picture of the patient lateral with the legs side by side. And the finger, the middle finger, touching the angle, the axle plate. So that is the correct, that is incorrect, the angle. And that's it. Where is the patient?
Right there.
So practice with a real patient.
Amanda's just going to give it a history. Come in front.
I have this for you. No, yeah, please. Okay, where is the patient? Vamos a hacer una introducción, ¿verdad?
Sí, lo va a hacer.
Pero porque no, pero ocupamos esto. No, porque ¿dónde lo vamos a hacer? Just one patient or two? Is the other one?
Yeah, another one's coming in 30
Ah,
minutes. A lady, older lady. But everything on the phone so that we can prescribe it. All the measurements, everything, right?
How strong is it? Do you have a phone?
Yeah.
Do you have one chair?
¿El bag la va a comprar?
Amanda, you give a little history of
Entonces vamos a escoger diferentes personas para que hagan diferentes medidas de él, ¿ok? Vamos a escoger diferentes personas para que hagan diferentes medidas de él.
History generally comprises of things that were present from birth or determined through genetic testing. So these include spinal bifida, myelomeningocele, bilateral club feet, bilateral hip dysplasia, microcephaly delay, global developmental delay, white matter body loss, ventriculomegaly, dysmorphic septum callosum, I hope I pronounced that correctly, cerebellum blindness, and autism spectrum disorder. He would have received surgeries previously for his spinal bifida, in addition to multiple surgeries for his club feet. In his current chair, he can perform independent transit from his bed to his chair in addition to his shower chair, and also perform self-propulsion using his upper body. However, he is dependent on his mother for general activities.
Dale la bienvenida. Dale. Sí. Dale la bienvenida. Okay. Say welcome to, what is the name? Matthias. In Spanish is Matías. Matthias. Hi, Matthias. How are you? My name is Giselle, and I and we all us will take you measurements for a new wheelchair. Is it okay? Always explain what you are doing, because I had some experience, a bad experience, because I don't say anything, and I was like taking measurements, and then the patient comes cry, and I say, why? What happened? And she thought that for the ataúd. Yeah. So it's very important to explain everything to the patient. So Matthias, come here. Welcome. Give the welcome to Matthias. Woo! So I need help here. So I'm going to choose two of you in each different way, in each different measurement to take the measure. Okay? So be attentive. I don't know who. No. Débole. Help, Mark. I need your help, please. So excited. Here, please. Facing, put him both.
This.
Oh, mom. He can. He's very active.
Oh my God.
He doesn't want. Whoa! Whoa, cuidado. Ready? Okay. Two of you. Gizmar, choose two. Or volunteers. First. Come on. Another. Actually, three volunteers because one more. Huh?
We need one more person.
Sí, pero quiero que lo hagan ellos. A ver qué hacen.
Any other volunteer, or I will choose.
One more. Okay, so evaluate. Ahora sí, it's your turn. It's all yours. Go, go. All yours. Take the bitrochanteric measurements, both. But I prefer the other boards, not this one. Because it is flexible.
Oops, sorry.
You are the professionals here, helping them. Okay. Go girls, go girls. Is the posture correct? Is it the posture correct to take that measurement? Bitrochanteric, both. Yeah. Actually, put the patient as B on the chair.
Ready? Thank you. Ah, nice. Come forward a little bit. Thank you. I love it. Right here.
So you have to move forward more.
One more. Nice.
As you want to be in a wheelchair. There.
Yeah.
Okay.
Good job.
Ready.
Okay, so this is going to go here on you. Right? Tap, tap, but on you.
Ready.
All right. Ready?
And he is very quiet. You have it's like. ¿Cómo será? How is the other patient? Is easy or? Oh.
We might have more.
Are you cold?
No. It's a big one. We have more complicated patients.
Oh, okay.
We have to.
Is it okay?
It's a little bent.
No, it's not straight.
Make sure it's not.
So, yeah, do it like this. Excellent. Good job. Girls, how many inches? 13 and a half. So always be up. So 14. 14. Put it. And that is the one or with excess? It's tight or with excess? Excess. With excess. And the other one? Ah, okay, it's tight. Okay.
Okay, so we come in my forward a little bit, right? What one wants to do. Ready? You have to hold this so it will slide.
Remember?
She likes you. Okay.
Yeah.
Good job. You good? One more, right? Thank you.
Close to the patient. Close to.
But we're doing excess, not inside.
Who is taking the you? Okay.
Thank you. Good job.
Okay. Thanks, guys. Thank you, girls. Congratulations. You did it good. 3 more. 3 more. Come on. Come on. Remember, he has patience, but not a lot. Please. Okay. You 3. You 3. You 3. Come. 3. You. You 3. Come on. Ya, que tenemos. Okay, ready? The next one is trunk width. Okay? Trunk width. Okay. How? Is your patient? Trunk width, you can take it there, but I prefer always take the measurements considering or imagining that the patient is on the chair, sitting on the chair. So turning, it's better. Remember, repeatable forms. More. Yeah. Okay. Trunk width. Hi. He helps.
Yes.
Hey. So, what do you think? It's okay. Continue. Doing this or this? Is it okay?
Are they doing it right or wrong? No, the guy, she's asking.
In front of the patient. See it? The tables are like this because you are posterior. So it's better to do it in front of the patient. So we take the measurement, the tables, and put it here. Woohoo! Arms up, please. Exactly, there. Okay? So you can put the tape measurement close to the patient, Exactly. And then it's 12. So why in front? Because if you put the tables like this, don't worry. You are seeing and you are putting the tape measurement close to the patient, so don't worry. But behind, it's more complicated. Oh, now shoulder width. Matthias, here. Matthias. Ready? Here, from here with your fingers. No, in front of the patient, it's okay. You take exactly with your finger.
What is that?
13. Thank you, girls. Next, 3 more. Gizmo, 3 more.
3 other, 1. We need 2 others. 2. 1 more.
Or we just.
Are you coming? You got 3? Okay, perfect.
Matthias.
Hi, Matthias. How are you?
Okay, next. What is the other with the other measurements? But in front? Remember, repeatable.
Yeah. He's gonna be off the chair a little bit. Hi, Matthias.
So we have here. What other width?
Oh, another width?
Yeah, always in front and then lateral.
Okay.
Finish. Oh, yeah. Go. And he needs that width, right? Because he's active. He's active.
Yeah. Fine. 1 more. 1, 2, 3. Okay. Yes. This is the one we didn't want.
Okay.
So we're doing this one?
No, in front, the width. Is it okay? How many inches?
Like about 13 inches. Right here. 13 inches.
12.
No, it's like a little more.
Okay, 13. 13. And foot? So be careful because he has this.
Yeah.
So in these cases, use the boards. and put not one over the other because it's not good. Yeah. Like this, exactly. You see? The patient put one feet over the other, so it's not good. We don't want it.
What about the last one?
11. Okay, put it on the form. Put it.
13 and 11.
Okay, 13 and 11. Thanks, girls.
Thank you.
So lateral. 3 for lateral. Come on.
Primo.
Coge tú.
Best years. One. 13 and 11.
Here. Here. This, we don't have the measurement here. We have to update this. But put
Also, but no, you can't come off. You have to stay where you are. Oh, you were using me.
ready?
You need to make a big exit.
What is the other measurement? Lateral. Take the lateral measurements.
I can put my finger for you if you like. Next one. And then you can take the next one. We have another. Who's holding it in the back? Oh. Slide that across the back a little bit more.
Exactly. So the sacrum, of course, good. And then take how many inches?
Yeah. 15. 15, right? Let's take last. Let's take last.
Is the same?
Yeah.
Yeah. 15.
Where you push. Okay. Yeah. Then maybe not already. We're doing lateral. So to the elbow.
Is it the same? 15?
Yeah, it was the same.
Okay, put it here. B, the letter B.
Left and right.
15. Now the leg length.
This one.
All lateral measurements.
This one, here to here.
There,
So you're gonna go.
leg, and rest.
Good idea. Good idea. Am I making an angle though?
Yeah. No, if you want, just take the heel. Take the heel, not with board.
Okay.
Yeah, just with the heel and take the measurement. Put here on the heel. Then take it. But in 90 degrees. 90 degrees.
I need to put them forward more.
Yeah. It's not the same measurement if you put the leg more extended, with the pelvis extended, so it's 90 degrees. Yeah, right there, right there.
Good.
11.
11 left. So look to left.
This is the C letter. C letter. Falta un paciente.
11 as well.
And the last one, armrest height. Armrest height.
Sorry?
Armrest height.
Armrest height.
What?
It didn't sound like that.
How it sounds.
Arrest.
Arrest.
Arrest something.
Arrest. Armrest. Yeah. See it. Okay. Matthias. 6, 6. On the other side.
Yeah, they saw that. They saw where you go. No, they saw both. No, his arm is up there. Yes. Good job.
But a kid. Hit them. Ah.
So then with the other side, even with the other
6.
side too long.
6 is good.
Yeah, so this side is too long maybe. Yeah. So come and check this zip
Because
different,
he said-
because there's no way it's 11. Whoa.
No, but it's around 6.
You said 6. Yeah. It was on 1 to 6. I mean, that's why it's 25.
Yeah, but it's 6.
Yeah. So 6 and
6. Okay, thank you. The last one is the posterior measurements. 2 of you. Last 2.
I love this song. Ah, yeah, it's one of my favorites.
Jumping on the bed. Jumping on the bed. To get a jumping on the bed. Jumping on the bed.
Last time I think he was using it to skip something.
Now, ooh, good.
Which measurements?
The last one.
Only
Is
the
that,
back?
yeah, the back height.
All right.
We taking a lie down?
The patient is not patient.
Yes.
Oh.
Yeah.
Okay, what are we?
You can put it seeing him. That side, seeing him.
Turn him around.
Yeah, turn.
We're gonna
Turn
turn
him.
around.
I'm going to measure.
Ready.
Oh, no, we could go on one side.
So, okay, you. Exactly, you. We have to be straight. Okay. Touch the scapula. Look.
Oh, you want until here?
Yeah. He is very active. He is very active. So, scapula, right? How many? 10. 10, maybe. Woo!
What a good
Here.
Oh, really?
Here.
Oh, we doen
Ja.
opgelost. Oh, underneath.
13.
Woo!
Ready. That's it. If you want to take C to practice, take it. C7. Just for practice, not because. Only one. Yeah, because it's flexibility. He has flexibility. So.
No, this side. This side. 18 and a half.
18 and a half, so 19. Okay? 19. F. F. Here. F.
Oh, I haven't been writing down.
Here.
The F, yes.
No, D, sorry.
D, yeah.
It's the D. 19, right? And the scapula? The scapula?
Wait.
Yeah.
13, right?
She's measuring again.
Okay. Thank you.
Get it? I need it.
Ah.
Otherwise, I'm going to forget.
We have another patient,
Oh,
actually. Thank you. Ready? So, yeah, we are ready. And now we have to imagine what kind of chair could you recommend him? Okay? So, no, ponlo en la silla. Mama can help us, please. Jumping on the bed, jumping on the seat.
Yes, you're so great.
Opa, opa, opa. See that one. See, he do the transfers by himself. What do you think? What you recommend? Frame, rigid or folding? Which one? Escuchar for rigid. For rigid. Say, raise your hand, folding. Folding, cross, folding, folding.
Raise your hand if you would recommend rigid.
So, in this case, remember, he has the old one, the old chair. Ask to the mom, what do you like to this chair? What do you like?
What do you like about his car?
Is there something that you like in this chair?
This chair, well, he has the stress since he's three. So, what I like about this chair, it expands to, it's supposed to go with him until he's about, when he have a lot of weight, so it wouldn't go with him. It's actually supposed to go until he's 10.
10.
But he has on a lot of weight from, so it wouldn't go with him.
We have to consider that. We have to control the weight, mom. We have to control the weight because how old is he? 7. It's big. So, but we suppose he is active and he will continue being active. So in these cases, I think, mom, we have two choices. One is the folding frame and another is the rigid frame. What is the difference? One, it's more heavier than other. Folding is heavier than rigid. But you can fold it and put it in many places.
Mom has a trunk. The chair goes in
No hay problema. No problem.
Well, then that's a factor, right? Because how does she get it something to the tray or something?
It's. Do you prefer some folding or rigid? What do you prefer? Yeah, it's heavier for you. So, another question: is he independent? Is doing self-propose, auto-propose? He proposed the chair.
Yes, he brings it to
A lot of.
yes, once.
And see it. Put the leg, the arm of the patient here. Where is the axle plate? Where is the center of gravity of the chair? Oof, very backward. It's not correct. So we are leaving just a small piece of the wheel that doing the propulsion. It's not correct. So we have to move that center of gravity forward. Okay? So it is because it's folding too. So mom, we recommend rigid wheelchair because we will have the center of the gravity more aligned with his center of gravity, center of mass. Okay. What other thing? Individual leg rests or hangers or fixed? Fixed. Me too. Mom, you need to remove this? Do you need to remove this or not?
No.
So good. We can have rigid. Excellent. With one. Yeah, but it's better to have this one in one piece, just one piece. Okay. What other question? I think that's it. Active chair with rigid frame, with rigid hangers. I think. Are you agree? Excuse me. We can discuss it. But here I prefer lighter than the lightest. The lightest is aluminum 7,000. Ready? Okay, now the other measurement that you missed is the front seat height and rear seat height. Mom, what about the height? It's available that he comes to the table?
Yes. Yes.
Okay, for you, that height, it's okay, or you prefer higher than this? So, having the old wheelchair is a good parameter to take that measurement because it is difficult. So, in this case, take please the measurement in front of the chair. Altura de asiento anterior. So, the front seat height, we have to consider the seat sling, okay? So, here, seat sling is to the tube, not 16. So it's 16. Maybe 18. Show her 18. 18 here, and then we will put the cushion, and he will be like this. Is it okay? Always explain the patient the height, because sometimes if you don't explain that, they can reject the wheelchair. So it is a big mistake. So it is cool. So 18 front seat height and rear, and that angle. Do you consider that angle is the correct, or you recommend more fixed tilt? See it. See him, sorry. What do you think? He's very active. We don't have problems with that. But remember, it's not good to be in 90 degrees. So most of the time we reduce 1 or 2 inches. So in front is 18, maybe back will be 16.
Yes. Currently the back is on 14, so we have
2 inches.
16 over here.
Okay. And what about the center? What about the inset? The inset. What about the inset? What about 0, 1, or 2? 2. Oh my God. Okay. He's 15. 15. But remember, we have to consider 2 inches more because he is growing. So maybe will be 17 with hip positioners. So 15, and he's I don't know where is here is 13. So 17 less 4, 13 is too tight. So just 1 inset, okay? One inch because not because that, because they will grow more in length than the width in the legs. Okay, now here. But he has that condition. So because of that, we have to manage just 1 inch because we have a lot of space there. Okay, and what about the center of gravity in the chair? We didn't see that, but we have 0 to 4. So it's here. I don't know if you can see. 0, 1, 2, 3, 4 inches. So please put your hands like this. Wow. He is like 2 or 3. Let's put 2 center of gravity. 2 inches. We can adjust it, so don't worry about it. Remember, always have this axle plate aligned with the arm. Always. So when you receive the product, we can adjust that. But we can ask in 2 inches. And the color, of course, later you can talk to her.
And most of these wheelchairs you can choose completely customizable color. So I don't know if Matthias has a favorite color.
Pero tienes una carpeta.
No preference.
He wants the wheelchair to be black.
No tengo.
Una carpeta de color. We have a palette of color palette, so it's a good tool to show, but later. So regarding the patient and measurements, do you have any doubt? Is it clear? So thank you, Mom. Thank you, Matthias, for your time. Thanks for being here. And later, yo le quiero tomar las medidas después.
Perfecto. Ahora Casey quiere llevarlos al showroom para que caminen.
Antes diles. Diles. Diles.
So everybody, thank you so much for helping us taking the measurements of the patient. In order to stretch our legs, we've been sitting down for a long time and we want to move around. Christy wants to invite us down to the shoulders.
So you're measuring, you're doing a group session
John.
just now and created a measurement for the person who did. We have a little task for you. So we want you to go downstairs and go around and see the item that the person needs.
Sorry, I want to take the measurements.
Okay. Oh, okay.
Give me 5 minutes. I want to take the measurements.
You should take measures to make sure.
Here. Give me 10 minutes.
When his arm is dropped there, is it that his tip of his finger should touch the axle as well?
Is that correct? Because you have 120 degrees to propose properly.
Listo. Entonces van a bajar.
No, el otro paciente no lo vamos a ver. Esta gente nos va a matar. Lo vemos nosotros. Le tomamos medidas nosotros.
Sí.
Dile a Cristi que no se enoje, pero es que la gente ya está cansadísima. ¿Y qué le parece? Pues yo sigo, pero
Okay, let me find it.
82 correos hasta
82.
82 correos.
Ay, Dios mío, yo ni lo quiero abrir.
Déjame, le tomo foto a mi correo.
Yo no tengo tanto.
Ayudándote.
Sí, puede ser como Pablo me iba a ayudar con lo de Giancarlo, seguro.
Me cae muy mal. Mis datos sirven para que me llamen, ¿vieron? Pero no me salen los WhatsApp ni nada. Porquería.
Se lo voy a guardar en mi mochila.
Yo voy a terminar rodando.
Ya, Daniela. No para de comer. Que estoy sucísima.
Sí. Entonces, ahorita que regresen ellos con el producto que escogieron, y si nada más quieren de que cada grupo que presente el asesoramiento que hicieron con la toma de medidas, y con eso esperamos nosotros al paciente.
¿No le explicas?
Sí, ya le dije que está bien.
Esta gente nos va a matar.
Sí.
Can I ask you a question? Yeah. How come, I know the wheelchair is not corrective, it's supportive, but how come you don't, or maybe you will, you just didn't, look at the club feet and kind of where they fall on the rest? Like, how come you want fixed there and not more adjustable to offer more, you know, so that it rests, so that, because right now he kind of crosses one over the other, exaggerates the club foot, and I assume progresses the condition.
Yeah, but in these cases, wheelchair is not enough. Is not the solution.
No.
He needs another orthosis. Yeah. He needs orthosis. Splints.
Probably first surgery.
Yeah. Yeah, because he's like this. It's not correct. We have to correct that, but not with the chair. Wheelchair is
Not corrected,
No.
yes, just supported. And if
Yeah,
you do
it's
anything,
just
they're gonna cause discomfort.
sometimes you can put a food box with divided food box, but I think
Still
he
past
doesn't
that
allow
point.
that. Let me check.
Yeah, so what they when they
If
come back.
we can move it, we can do it. But if not, yeah. You see,
So the foot box would be that then
it's
put it
one box
inserted
but
in here.
divided. But I can't.
Right.
It is fixed. So in this case, we recommend the splint because he's 7. He needs that. And touch here, a lot of pressure. Touch.
Yeah.
Bad
Yeah.
angle.
Yeah.
It's difficult.
Yeah.
It's a big risk. Oh, but we can fix that. See? So in this case, just put in there.
Because even this, anyway, but
Yeah.
yeah, yes. Okay.
And maybe put in ADD supports, adduction supports here. Yeah. Here's another topic for more time than now, but what postural is a huge word. So here I have to recommend it, ADD or adductor supports, for avoiding that.
Yeah.
Preventing more abduction.
Yeah.
Yeah, we need it because he's growing and in a bad way.
Yeah. Yeah.
That is very risky. And maybe in its
Yeah.
touch it.
Has
Fix.
he had a tenosis before? For the tendons, for the foot foot? Has he had a release? I think that's really what. Yeah. Yeah.
They had numerous. They had, I think, 3 by Princess Elizabeth, 2 in the States.
And it just recurs each time. Yeah.
Yeah, because with the braces, although he has 3 different braces, what has happened because his skin is like paper, the braces and everything breaks down. So he had ulcers on his foot
From the boots and from like the
Yes,
boots and
from
bars
the
one.
braces.
Yeah.
So it's, as they said in the state, 1 foot forward and 2 foot forward.
The other patient is there.
Yeah, well, if it's breakdown, yeah, that's no good.
But it healed now. But it
Actually,
was there for 2 years. See?
wow.
Just finally healed. So on both sides, he has.
And you would have the surgery and immediately go into
And
the
maybe
brace, or you would have
No,
small
they will have
delay.
the surgery. They normally put on cast for maybe about 2-3 weeks.
Yeah.
And when it's done, they go into the brace. But we have to find a way of getting the brace inside of the brace to be, I don't know, soft or something to help silicone, or it has a silicone, it still breaks down, just the friction of
I mean, I know the braces that we got here are not the best. But yeah, if you had it in the States, that's
Yeah.
Yeah, because he has one.
This is very
Because he has
surprising.
a gate trainer also that he has. For the wheelchair, the gate trainer is, a gate trainer. So he had the brace for
because you
physical
see
therapy.
how the
short
foot
one
is here too. I mean, the ulcers also.
Yes.
You're at risk because of the position in the chair, not just the braces, right? It's his position at rest is, even in terms of blood flow, everything going down.
Mom, so go there again. I take the measurement. Yeah. You want to see? Ah. Okay. ¿Quería me ayudas? Tomar la media. Sí. So again, so fast, I promise. Ay, ¿qué me hicieron en la cinta?
Perdón. Ah, te la llevaron porque era de ella.
Ay, qué madre. Ah, bueno. Vamos a llenar la mía. Es esa. La voy a revisarla yo. 13, sí, ancho de hombros. 13, ¿sí? ¿Me ayudas con las tablitas de aquí? No, el trunk shoulder. El de shoulder width 13. ¿Verdad? Shoulder width.
Trunk width tiene 12.
¿Dónde se lo pusieron? Ah, width of scapulas. 13. Ancho de tronco no importa. Omitamos ancho de tronco. Aquí. Entre las tablitas. $13.
Este tiene 12 también. Este sí es el trunk width.
Pero es 13.
Yo la quito.
Sí. Bueno, lo quites, ponlo a la parte, entre paréntesis, para saber qué fueron las de nosotros. Aquí, ¿ves? Pétalas aquí. 14, sin excesos. Y con excesos. No la apretemos mucho. Ahí. Toma aquí. No, 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 no. 15. 15. Ahora la profundidad. Ahora la profundidad aquí. Usted no va a tener mucha paciencia. Ahí.
Rápido, chapalán. 15 también.
15. 11. 11. 7. Apoya brazo. 7. 13. Escápula. Ahora vean. Le vamos a pedir que le llegue aquí porque está creciendo. Entonces se lo vamos a pedir de 12.
¿Pongo escápula? No.
No sé si ponérselo de 10. Es que le sumo, pero es que tiene 7. No, denle 12. Ponga pedir entre paréntesis. No, pero nada más ponga aquí en observaciones. Pedir altura de respaldo 12. Ahora aquí. Luego ponle también poner soportes de ADD de rodilla. Que él hace esto, pero él los mueve. Entonces no importa. O sea, no lo voy a hacer así porque lo que voy a hacer es estimular lo que siempre así. Yo le voy a hacer un intermedio. ¿Sí? Sí. Entonces ahí el ancho de las piernas es de 13.
¿Y esta cuál es?
Está igual. 13. Y el ancho de los pies, espérate, ayuda. Si aquí es 13, aquí es 13, aquí es 11. Bien, ¿ya? ¿Listo?
Eso sería un 15.
Sí, porque él es 17. 17 menos 4, 13. Queda muy tallado. Entonces es de 1. Listo.
¿Entiendes mi letra, no?
Sí.
Pero están muy bien las que tomaron.
Sí,
muy poca diferencia.
Quedó 2, nada más. Esta, porque no se entendía bien y te la marqué.
Sí. Aquí vamos a tomar la otra. Entonces, ya nada más Cristi quiere que cada equipo como que presente un equipo y ya se va.
Les va a dar algo. Que presente un equipo. ¿Pero cómo va a presentar un equipo? Yo diría que ni siquiera es que ellos no saben del equipo. Yo diría que más bien que ellos digan, este equipo a quién lo recomendaría. Más bien, yo lo haría así. Bueno, pero ya no ocupamos tomar medias. ¿Quién lo devuelve?
Para el otro.
Para el otro paciente, sí. Ya está ahí, ¿verdad?
Sí, ya llegó.
La podemos tomar de una vez, por decir, para que no esté.
Es una señora. No, lo que hacemos es decirle a cada uno, a usted le tocó el pacing, a usted le tocó la coyotiplas, a usted le tocó la iris. Ahora en grupo tienen que decir a qué paciente se lo van a dar y por qué. Bye bye, Matthias.
Was it very different, your measurement?
No, a little bit. Was very good. It was very good. Ay, thank you. Ah, yeah, we need this. Necesitamos recuperarlos para los otros cursos.
Okay, guys, can I have this back, please? Thank
Son 10. Hay 2. 6, 8. Faltan 2. ¿Faltan 2?
Exacto.
¿No? 2, 4, 6, 8.
Ah, sí, faltan 2. Ella llevó
No se pregunte quién.
We're doing measurements in the corner. Whoever wants to be a part of it, otherwise we'll go ahead with presentations. Because we know it's running a little later than.
Observing you with the measurement.
Hi, nice to meet you. My name is Giselle. Susan, nice name. Qué linda. She's very nice.
Probably the same would be like the total time that you spend in your wheelchair on a day. You spend the whole day. So you say 3 to 5 hours a day or less than that? Less than that, perfect. So you don't usually use it to travel many long distances during the day.
No, it's okay. ¿Qué hacemos? ¿Pasamos allá?
No, vamos a hacer privado y van a continuar.
¿Quién? ¿Lo va a hacer Cristi? ¿O nosotros? Ah, ya la va a hacer la actividad. Ah, ok.
¿Y dónde ha tomado la medida?
En una silla.
Tú que la tienes.
No, it's okay. Ay, es que nosotros pensando que se la llevó. So, we have to move there. It's okay?
Oh, I have to go there.
Yeah, please.
Okay.
We can help you.
If I ask you, what is your desire with the chair? What do you decide?
My desire?
Yeah.
Well, I can't use my hands, so I can't get a normal wheelchair to move. Right, so my desire would be a very simple chair, but motorized.
Motorized? Wood?
But simple, that's it. No.
When you say simple, what do you mean?
Well, no headrest or anything like that that would make it go up in
Just
height.
something comfortable.
Simple and comfortable.
And power.
Can I suggest she has a challenge with the spot that her feet rest on there a little low. So sometimes I have to get a bench to raise it so that it doesn't block circulation here.
Yes. Your feet start to feel like something.
Yes.
Yeah.
She gets
so,
cold.
Okay.
I have rheumatoid arthritis and it's really, really bad. So, it's,
Do you have pain
not
when I
now,
do
no.
this?
No, but I'm on painkillers right now. So I have it everywhere.
The pain. Was it locked or unlocked?
I was saying locking.
See this?
Not, it is really
Could you see this?
Yeah,
Yeah.
I have
It's
a right hip
postural.
replacement. Right now, one of his screws came out and I have no any
Mm.
braces in my body.
Somewhere there. The
Mm,
bone is
it's okay.
getting brittle.
So we suppose something like this.
That was hurting.
So your desire is a power wheelchair.
Motorized.
I can't afford it. So I would normal that would, you may ask me my desire, right? So,
Of course.
but a wheelchair like this, maybe if I could use it. I'm really not supposed to walk because my left hip is really, really bad.
Mm.
So the doctor told me last time to try not to be moving around too much because of my left hip.
So where we going in this power wheelchair? I want to know.
Oh no, out.
Yeah.
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 Because right now, what I'm able to do is go
Independence.
for appointments or see
will
the
look
doctor.
amazing.
Yeah, but if I have a
Looking handsome, man. Finding a boyfriend. Ah,
But just to
okay.
be able to move around
independent.
right. Yeah. Go to grocery, go to movies.
Is that?
Yeah. That would be like a blessing.
Like to get in and out of the house.
Oh,
Like what kind of house?
So I have to lift her with someone downstairs.
So you have stairs. Okay. And then
Do you have pressure sore?
Sorry.
Do you have pressure sore? Scars?
So any
Oh no, I have one of those mattresses that bubble mattress thing.
right, like the
Yes.
memory foam ones that
Okay.
don't create the sores on your body.
That's right.
Porque anda mucho en carro.
That's on circulation.
Yeah.
Just simple
Yeah.
and as you say,
Yeah, but
Yeah.
how many distance do you think you will drive in meters? How many distance? In kilometers?
If I went out,
No.
No, with the power chair.
I mean, like when I
Maybe
go to
not today, but
well, you see, when you have a choice, it's different now.
Yeah, where you
You're
would want
open
to go, like to the Savannah or like
to the
so that's what
mall,
you mean, like where she would
to the mall, right up by me. I have a hairdresser, and then I could go to wait, it's not too far because in Trinidad, sidewalks and stuff like cater for people like me.
but Christy no puso nada. Yo, la gente, the people are waiting, so I don't know. Okay, so yeah, please. Try and
Let me just twist it here.
angle is Elizabeth. So
Yes,
yeah.
you're
where it is where it stays.
Okay, that's fine.
no sé si algo tan básico como una Félix, pero por lo menos le pondría a la Félix un JDC.
Sí.
Okay. Oh, crack.
It's very bad, you
Yeah, any volunteer that can help.
My neck cracks.
Yeah. Actually, I prefer an anatomic backrest for you.
Sorry?
I prefer an anatomic backrest for you.
Oh.
Better because you have here.
I have full
You need more support here.
I have full bad vertebrae, yeah.
Yeah, not upholstery like that.
Not soft like that.
Yeah,
Yeah.
more something more rigid and contour.
You're right.
Are you okay?
Yeah, yeah.
Okay. Because of this, see it. You need support here and feel here. More comfortable. Okay. See your hands. So, okay. If I am the joystick, the control, okay, you have to move it.
Move my finger in front, back, and diagonal. Good. So again, again, again. Good. You are strong. Good for you. This is your hand that you will use?
Yes.
Okay. Sería mando derecho y sería joystick convencional. Ok. Joystick, right joystick, conventional joystick. J3 back with lumbar support, but not with laterals. Not with laterals. She doesn't need that.
What's that?
Is that like my hands here?
Oh,
Permanently.
okay.
You don't
No,
want
I
it,
don't
right?
need
Okay. No restrictions. Pain?
Not yet.
Oh, pain?
No.
No.
Hearing it?
Yeah.
Yeah.
But pain?
No.
Okay.
But
She has crack.
I'm on team killers, right?
Because they
Not too long ago.
So at what time of day usually do you get pain? In the morning, in the afternoon, night?
Oh, in the morning when I wake up, you know, but it doesn't take me very long to move that. Okay. You know,
Fell the other.
yeah,
Such a good idea. To the chair so she can pull herself.
I stepped off
To
the
the-
chair.
to the
I
box.
put myself.
¿Dónde está la cinta métrica?
I encourage her to do it because one time she was hospitalized for pain for 11 days. She's scared. She's good. So she uses her days to correct.
Push my hand. Push. Good. Good. Strong here. You are strong here.
Yes.
It's very good. It's very nice. So, for example, if you want to stop the chair, you have to put out your hand. So, do it. Again, touch my finger. Push. Stop. Stop the chair.
Oh.
Exactly. Because you can crash with something. With someone.
That's got insurance.
It's okay. Listo. Hablando de eso. Va a necesitar el J3 con soporte lumbar. Ya. Va a necesitar J easy cushion. So I have two options. One is a cushion with fluid, like gel, and the other one is with foam, memory foam. So one is more comfortable than the other. J fluid is more comfortable, but with more maintenance, because with the years, passing the years, maybe we'll experience that the bag is broken. Okay, so you will change the fluid. With the memory foam, you don't have that problem. So what kind of cushion do you prefer?
Without putting memory foam.
Memory foam. This is J ion. Ion.
Yes. Yeah.
Yeah, because I can't do anything for myself. So the less things that I have to ask people to do.
Now, what about this height? Is good for you? Is very low or
No,
this
that height is fine.
It's good? That height, not that, right? That is different. See? Yeah, this is the height. But it is okay for you. Why is okay? Because you can transfer by yourself? Okay. Yeah, because it is very high.
No, because to get up
It's 20.
is difficult.
It's 20, pero en realidad it's 90. Yeah, I have to consider that. So the frame probably will be, their height is 19, so probably the frame will be 17. And then with the cushion, it's gonna go up and will be 19. 19, yeah. 19 with the cushion. So the frame will be lower than this, but the total height will be 19.
With the cushion,
Do you want to fold the chair? Okay, if you want to transport it.
Different size cars.
Yeah.
This one is
Felix or Felix. Okay, we have two options. One is folding, like front folding, and you can pull the chair. And the other one is remove the batteries. Yeah, the battery, and then fold, and again unfold, put the batteries. What do you prefer?
Is it heavy?
It's heavy. But the first one is strong, normal, but the other one is more strong, it's more power, has more power.
Oh.
She's a very good driver.
Es que es mucho más fuerte la Félix. Normal. It's easy to put, and it's easy. Put the batteries. It's easy. No, it's not complicated. Just but it's heavy, but you could manage. But the other one, actually, we will send both, and you can decide which model you want. What do you think? Yeah? Yeah. You block the motors, and then you can push.
So you can use it manually or use power.
But it's heavy. It's heavy. It's heavy to push because they will change heavy. It's not too heavy, but it's not as this. The weight is like 170 pounds.
Wow.
Without batteries, no, it's less than that.
So yeah, the
That's
battery.
heavy though. Who's gonna get that in the car?
You have two persons.
No sé si yo le recomendaría más. Bueno, pero es que no sé si se le puede poner la R50. Que de fibra de carbono para que no pese nada. Yo creo que no puedo. ¿Cuánto tiene de peso? ¿No sabes cuánto tiene de peso? Yo creo que a ver ella mejor la Félix por el sistema de respaldo. Pues mándale las dos. Okay, we will send you two options, and then with calm, reflex, you can decide. Okay, both are good.
Because her shoulders are collapsing, just like the wrist, and the neck is collapsing.
Because of that, I prefer the folding wheelchair.
Yes, I prefer. But this part, well, you see, it's hard, but sometimes arms get tired. And I've been looking for a cushion to help, but I'm not finding anything right now. So, what do you recommend?
I think it's a bit high.
They are height adjustable.
Yeah.
They are height adjustable, so you can adjust the height.
Okay.
Yeah, Felix. Felix no tiene eso. Felix.
I have to get one of those hydraulic jacks to lift it up to the back and put it in.
For the vehicle.
Yeah.
Some vehicles are modified like that.
Yeah.
Where I see some customers have that. Yeah, of course, it's a little more money. But the back of the vehicle drops down.
Oh.
So somebody bought that vehicle.
No, relax. Don't worry. 9. Ancho de piernas de 10. Ancho de piernas 11. Que los hizo también. Ah, thank you. Aquí nadie porque me ayudes. Okay. You?
Thank you.
Push. Pushing. 12. No, 11 and a half. Now, are you gaining weight? How much?
I don't know. I think
13.
I think I weigh about 90 pounds, 72.5, and then I had to put on weight. When they told me I was 72 pounds and 3 pounds. Yes. Yeah, because
11 and a half.
I was freak out.
Yeah.
I said,
12.
I'm going to die. So I started to, yeah. No. With this disease, I found, yeah.
15.
15.
No.
14.
And also try to put on weight and also compromise my knees. And yeah.
Here. There. Relax.